Welcome, good afternoon. Welcome to the Assembly Committee on Health and Human Services. Playing some musical chairs. There's a lock on there. Would the secretary please take the roll?
Assemblywoman Gonzalez. Assemblywoman Gorlow.
Here.
Assemblyman Gray. Assemblyman Hafen. Assemblyman Hibbets. Assemblyman Koenig. Assemblywoman Newby. Assemblyman Wynn. Assemblyman Orentlicker. Assemblywoman Taylor. Assemblywoman Thomas. Chair Peters.
And I am here. Please mark Vice Chair Orentlicker absent excused today. Welcome, everybody. We're going to go over a couple of housekeeping items, and we have a short work session, and we'll go into our bills. General housekeeping, please make sure your devices are muted so we're not interrupting folks. Public testimony. You are welcome to come to the table. If you do choose to come to the table, please leave a card and sign in over by the front door there so we have a record of your name and those who are interested in these bills. You may submit public comment up to 24 hours after the adjournment of the meeting in writing in a variety of ways, all of which are on the agenda. If you wish to testify in person, we went through a couple of those things, but I do ask for an orderly flow of discussion. All comments, questions, and responses, please must go through me, and I will let you know if you can go directly to the committee members. Also, committee members must be recognized by me before you can speak. Presenters on Zoom, please leave your cameras off and your microphones off unless it is your turn to present or I've directed questions to you. And when testifying in person, please remember to turn on the microphone to speak and off to listen so that we can avoid the reverb between our facilities. With that, we'll move on to our first agenda item, work session. We have 2 items on work session today. The first is Assembly Bill 45. I'm going to ask Mr. Ashton to please go over this bill.
Thank you, Madam Chair. For the record, Patrick Ashton, Research Division, Legislative Council Bureau. Assembly Bill 45 was heard on March 1st. It creates the student loan repayment for providers of healthcare in underserved communities program administered by the State Treasurer to repay the student education loans of qualified healthcare providers. Further, the State Treasurer shall specify by regulations certain methodologies, procedures, and standards relating to the program, including the prioritization of certain healthcare providers when awarding repayments of such loans. Additionally, the State Treasurer may adopt any other regulations as necessary. The bill provides a healthcare provider is eligible for this program if the provider is a state resident, graduated on or after July 31st, 2023, with a health-related degree from an institution of higher education in Nevada, is actively licensed, certified, or registered in good standing to practice as a healthcare provider in the state, and commits to at least 5 years of clinical practice in certain underserved communities. Amendments. Eric Jimenez, Chief Policy Deputy's Office of the State Treasurer, proposed the attached revised amendment after the hearing. In summary, the amendment, number 1, revises in Section 4 the definition of a provider of healthcare. Number 2, removes from Section 7 the program eligibility requirement for a provider to have graduated on or after July 31st. Number 3, adds a new requirement in subsection 3 of Section 6 that in administering the program, the State Treasurer shall, to the extent possible, use 15% of program funds available in any year for providers who commit to practicing in a county whose population is less than 100,000. Number 4, revises subsection 3b of Section 6 to also prioritize providers who accept patients enrolled with Medicaid or CHIP when awarding repayments of such loans. Number 5, revises subsection 4 of Section 6 by adding psychiatry to the definition of primary care. And number 6 adds in subsection 3 of Section 7 counties with a population less than 100,000 to the criteria of an underserved community. Madam Chair.
Thank you, Mr. Ashton. I will entertain a motion to, are there any questions from the committee members before we move into a motion? Seeing none, I would entertain a motion to amend and do pass from Assemblywoman Gonzalez and a second from Assemblywoman Taylor. Are there any discussion on the motion?
Yes, ma'am.
Please go ahead, Assemblyman Hafen.
Thank you, Madam Chair, and I want to thank the treasurer and his office for working on this amendment. I did just see that this morning. I will be voting this out of committee. I will reserve my rights. I do believe that it has addressed all of my concerns, but I do want to just dive in just a little bit further, so I do want to reserve my rights today. So thank you.
I appreciate that. As always, you have the right to reserve your vote on the floor. I appreciate your commitment to passing out of committee, though, today, so we can continue to work on making sure the amendment language gets to the point of the bill. Are there any other discussion items before we? Assemblyman Nguyen, please go ahead.
Thank you, Madam Chair, for the opportunity to address this on public record. I spoke with the Treasurer's Office and am very, very pleased with this bill. Although I just wanted to make sure that we put this on public record. In my conversation with the Treasurer's Office, is that in terms of regulations, when it does pass out of this House, is that we prioritize providers that has additional language abilities so that we can continue to serve the underserved communities in our state. According to the census data that we get, we see that there's a lot of languages spoken in Nevada, and we would love to have the opportunity to recruit those providers that speak those languages. And the Treasurer's Office did agree with me that we should put this on public record. So I thank you, Mr. Jimenez, for working with me on this, and I am staying in still support of the bill as it's written. Thank you very much. Thank you, Chair.
Thank you so much. And as a reminder, the regulatory process does also have a public process where you can participate in that, and it will come back to us through Ledge Commission for final approval. Assemblywoman Newby.
Thank you, Madam Chairwoman. I really appreciated the brilliant point of my colleague regarding the previous restriction to Nevada institutions, particularly around where there's a practice that doesn't have that level of education existing currently in Nevada. That said, subpoint 2 in the amendment removes that requirement for it to be for these students to be graduates from an institution of higher education in Nevada. I would like to see during the rulemaking process for preference to be for graduates of Nevada institutions, not necessarily a requirement. Understanding that there are many residencies that we don't have in our state, it would be nice for us to be able to lure back some of our grads after they're done doing their residencies to come back and serve their communities here. So thank you.
Thank you for the comment. It sounds like we have quite a few people who will follow this through the regulatory process, make sure that we are getting this right. Are there any other discussion on the motion? All right, all those in favor, please signify by saying aye. Aye. Those opposed, nay. That motion passes with all those present. Our next work session, please go ahead, Assemblywoman Taylor.
Madam Chair, so will we call that then a do pass as amended?
Correct, that was the motion, do
Okay,
pass
just
as
wanted to make
amended.
sure. Okay, thank you so much.
Yes, yes. So then, oh, floor assignment, thank you.
Meets Nevada Post requirements for certification. All instructors meet Nevada Post qualifications for instructors. All new officers.
I'm corrected. It is amend and do pass. Yeah, in our house. It switches between the houses. Language preferences. And the floor assignment, I will go ahead and give that to Assemblywoman Taylor, if you would. And we will move on to work session for Assembly Bill 136. Mr. Ashton.
Thank you, Chair Peters. For the record, Patrick Ashton, LCB. Assembly Bill 136 was heard on March 1st. It requires an operator of a qualified residential treatment program that provides care and shelter for less than 16 children to obtain a license as a childcare institution from DPBH DHHS. Any qualified residential treatment program operating on or before January 1st, 2024 may continue operating without such a license until July 1st, 2024 under certain circumstances. There were no amendments proposed to this measure. Chair Peters.
Thank you, Mr. Ashton. Are there any questions from the committee? Seeing none, I would entertain a motion to amend and do pass from Assemblyman Nguyen, and a second from Assemblywoman Gorlow. Is there any discussion on the motion? Seeing none, Assemblywoman Newby.
Chair, I believe it's just do pass.
Thank you for catching that. You're correct. Do pass, not as amend and do pass. So do we have to rescind the motion then? Or can we revise the motion? We're revising the motion to do pass. So move from Assemblyman Nguyen and second from Assemblywoman Gorlow. Thank you for catching that. Any discussion? All those in favor, please signify that by saying aye. Aye. All those opposed, nay. The motion passes with those present. Thank you so much.
What skills built up to actually deal with folks, to talk to them, and they eventually learn communication.
I'm going to assign that one to Assemblywoman Thomas. Thank you, Chair. Thank you. All right, and I said we were going to move into our hearings, but we have a bill introduction that we will do here while we have everyone present. So today we have a bill introduction for BDR 38977, which revises provisions governing Medicaid. Do I have a motion to introduce from Assemblyman Nguyen, second from Assemblywoman Gonzalez? Is there any discussion? Revises provisions governing Medicaid. As always, it's a bill introduction. This does not commit you to the bill in any way, shape, or form, just allows us to introduce it on the floor. Any discussion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay. Motion passes with those present. Thank you. All right, now we're going to move into our agenda for the day, our bill hearings for the day. We're going to take these in order. So the first up is Assembly Bill 116. We have Assemblywoman Brown May in the room. Please go ahead, come up, get yourself situated. Remember to state your name for the record. You may begin when you're ready.
Thank you, Madam Chair. Members of the committee, it is an honor again to be before you in this committee. For the record, my name is Tracy Brown May, and I am the Assemblywoman that currently represents Assembly District 42 in Clark County. This is a great day. I hope that you're going to enjoy this as much as we are. I have two co-presenters that are with me. And so as we jump in, I just want to identify that this bill requires healthcare providers to provide information and referral to support services related to Down syndrome to a person who has received a positive prenatal or postnatal test for Down syndrome or the parents or guardians of a child of Down syndrome. And I have a parent of a child who is now an adult, but will always be her child, with Down syndrome, who are really here to talk through this issue. So I'd like to introduce you to Diana Rovetti and her son, Jack, and I will turn it over at this point.
Welcome to the committee. Thank you for being here. Please remember to state your name for the record.
Thank you, Chairwoman. My name is Diana Rovetti, R-O-V as in Victor, E-T-T-I, and good afternoon, Chairwoman and committee members, and thank you so much for allowing us to be here today. I would like you guys to just close your eyes for a moment and think about a time in your life when You had a moment that you will never forget. You remember where you were, who was with you, how you felt, what the smells were, what the lights were. And this might have been a happy moment or a sad moment, but it's something that just sticks in your heart forever. Just hold that thought for a moment. I have a time in my life when time stood still for me more than any other moment in my life. I remember it vividly. The sights, the sounds, who was there, where I was sitting, who was in the room, the sounds, the feelings. Most of all, I remember the feelings. You probably remember the feelings around your moment also. My moment should have been a joyous occasion. I should have been celebrating. I should have been very happy. I had had 3 daughters. I've been wanting a son for my whole life, and I had my baby boy in my arms. But I felt sad. I remember friends stopping by, and I didn't know what to say to them, so I said nothing. I remember calling my mom, and I remember the words I said to her, and there were tears, and I was very, very scared. My moment was when my pediatrician told me that he suspected my baby boy, the son I had been dreaming of and hoping for and waiting for, might have Down syndrome, and that stopped time for me. So as you can imagine, the way that your moment is resonating with you, that moment has stayed with me for 24 years. This moment happens for parents in Nevada approximately 50 times each year. Sometimes, a lot of times, parents are given a grim outlook when they should be offered information and hope. If I would have known in 1998 what I know now, I definitely would have been celebrating. Because it was this boy that made me a mom of a boy and a very, very proud mother of a son with Down syndrome. I'm a fourth generation native Nevadan. I'm mother of 4 daughters and one son, Jack. This handsome young man sitting next to me has definitely changed the course of my life and definitely changed it for the better. I also believe that having Jack as a brother has changed the lives of my daughters for the better and has guided their careers as well. I want to tell you about a study that was done in 2011. Dr. Brian Scottco, Susan Vine, and Richard Goldstein published a study on the self-perceptions from people with Down syndrome. I don't know how much you guys have been around people with Down syndrome, but when I had Jack, I had really hardly ever been around anybody with Down syndrome. I remember one guy in my class that graduated with me in high school, Churchill County High School, and all I remember about him was him walking around in a group with some other students down the hall. They were never included or accepted, by the other kids, and I think that's really important. If you've never known what a person with Down syndrome thinks about themselves, that's why I want to tell you about this survey. So, among the people surveyed, 284 people, about their self-perception, 99% of the people with Down syndrome indicated that they were very happy with their lives. And in the general population, I don't think we can come anywhere near that number. 97% liked who they are, and 96% liked how they looked, if you could imagine. 99% of people with Down syndrome expressed love for their families. The authors of the study said, in our qualitative analysis, people with Down syndrome encourage new parents to love their babies with Down syndrome, mentioning that their own lives are good. They further encourage healthcare professionals to value them, emphasizing that they share similar hopes and dreams as people without Down syndrome. Overall, the overwhelming majority of people with Down syndrome surveyed indicated they live happy and fulfilling lives. And so I may be preaching to the choir, but I just want to let you know that people with Down syndrome lives have value, and they enrich our lives and the people's lives around them. So one of my colleagues, no? Okay. All right. Okay, so with that being said, I'm now turning this to Jack.
Welcome to the committee, Jack. Thank you for being here. Would you mind stating your full name for the record?
Yes, of course. Did I speak clearly? Okay, good.
Say your name for the record.
Okay, well, my name's Jack Reddy. Chairman of the Members I went to, no, I graduated from Reno High School to UNR, and I have a lot of friends, and I love my family. And I have my own business. It's called Jack's Popcorn Company. You know about my popcorn really well. And I volunteering at Piccolo School. I helping other kids, with chills, people. And I work at the Eddie bar, it's outside bar. And yeah, it's downtown, you know. And all by myself. I think you should have a perfect mom, and that I just happy I have my own Down syndrome. And I'm happy in my life, and I'm happy how I am, and also I just tell your mom is they have perfect baby, and yeah, perfect baby. It's perfect. And that's it.
Diana Rovetti, quickly for the record. We sent out a survey, and the reason that this bill is needed is because I have comments from parents all across the state of Nevada with their birth story, with their diagnosis story, and almost all of them are negative and saying, a lot of doctors saying, I'm sorry that you have this baby. And as parents, we think that this day should be celebrated for all babies, especially babies with Down syndrome.
Thank you, Tracy Brown May, for the record. As you can hear, that many times misinformation around people with Down syndrome is represented. And so this bill really asks for factual information to be presented to parents who receive a diagnosis prenatally or postnatally that their child is affected with Down syndrome, and that they understand that their child can be wonderful, happy, productive, successful individuals in our community. The bill itself simply says that upon receipt of a positive prenatal or postnatal test result, that the physician, nurse, practitioner, anyone who presents that information would be required to present information and a referral source to that family member. That's the whole bill. We'll be happy to take questions.
Thank you so much for the presentation. Thank you for being here. It's great to see you, Jack. And we are all familiar, I believe, with your popcorn. And if not, I think Miss Brown May has the opportunity to become familiar with those. And I'm going to take a moment of personal privilege, because when I was in high school, I'm about the right age for you to have been in my RAVE class. I volunteered with RAVE, which is a respite program for families who have children who have developmental disabilities. And we took care of kiddos, and you are about the right age for a kiddo who was in my class. I don't know if it's exactly the same, but it brought tears to my eyes remembering those days. It was a long time ago. Okay, questions from the committee members? All right, we've got a few. Assemblyman Gray, we'll start with you.
Thank you, Madam Chair. First, Jack, I want to say you're perfect, dude. I have, and I think this is the same experience most of us have have had in our lives. Never, ever met anybody with Down syndrome that was not happy, smiling, and made us stop and think, hey, life is good. No matter what's going on, life is good. So I just want to, and this is a concern I've had about this bill, and I just want to make sure this is going in the right direction. So I had a family member that had some prenatal testing done. Some numbers were really screwed up. They met with the geneticist, and the geneticist, basically the first words out of that geneticist's mouth was, we recommend termination. I want to make sure that that's not going to be what this bill is really about. I want to make sure that, these.
Thank you, Tracy Brown May, for the record. I have spent 22 years. You're going to make me cry, so don't do that. 22 years supporting amazing people with intellectual and developmental disabilities. This is about enabling an enhanced conversation about the true capabilities and wonderful things that people with Down syndrome can bring to our communities. I would never want to be involved in that decision-making process for any parent, but our goal is to make sure that parents have as much information as possible so that they know how wonderful a person with Down syndrome is and what their true capabilities are before they make any decision. It's a great question. Thanks for asking.
And I would direct folks to the language of the bill. In this bill, there is no obligation of anybody but the physician to provide readily available information about resources within the state of Nevada. And Assemblywoman Thomas.
Good afternoon, Chair, and thank you so much. And thank you for this presentation. It warms my heart. Jack almost made me cry, especially with his, how did he put his mom? You know, I hope my kids call me that too, but they don't. Anyway, my question has to do with Section 1, subsection A1. I just want to know why the life expectancy for people with Down syndrome has to be in there. Why is that recorded?
Tracy Brown May for the record. This language really is modeled after some other states that have produced acts that are very similar to this. At one point, the life expectancy of a person with Down syndrome was not as significant as it is today, and unfortunately, many times our folks with developmental disabilities passed away very early in life. That is no longer the case, and we're now living into our senior years. And so life expectancy was probably just identified as a way to be able to show that you can have a full and wonderful lifespan.
Thank you for the information. Are there other questions from the committee? All right, I'm going to start with Assemblywoman Gorlow and then Assemblywoman Gonzalez and Assemblywoman Taylor.
Thank you, Chair. Yes, I just had a quick comment. In my other life, I work with a lot of families who have children that have intellectual and developmental delays, and we see a lot of children in early intervention who have Down syndrome. I think this is wonderful because I hear many times from these families, I didn't know I qualified for services. And this would allow them that opportunity to say, hey, this is a birth qualification. You do not need to have a developmental assessment. You automatically qualify. And so go get those services right away. So I just wanted to thank you for bringing this bill forward.
Assemblywoman Gonzalez.
Thank you so much. I just have a comment as well. Thank you so much for being here and bringing this important piece of legislation. And it's awesome to see you in committee today. Thank you.
Oh, okay, Assemblywoman Gorlow.
I'm so sorry. Can I also co-sponsor?
Tracy Brown Ray for the record. I'm happy to have anyone join us on this bill who would like to be a part. Yes.
Assemblywoman Taylor.
Thank you, Chair. And thank you to my colleague, and I will chase you down with a pen, just so you know. But thank you so much for coming and sharing your story. Jack, I have never been so impressed with a young man since I've been here in this legislature as I am with you right now. The poise, the confidence that you sit there with, and you got your jacket on, and your hair's tight, and you look good. Maybe looking for looks. See, yeah, that's what I'm talking about. Yeah. Get that on the record. Somebody get that on the record. But I am just so incredibly impressed with you and just the way that you carry yourself, and really appreciative. I used to be on the school board in Washoe County, and have spent some time at Piccolo. So the fact that you can be there and you volunteer your time with young people who aspire to live their lives like you have is just amazing. You're such a role model, such a trailblazer for them. I can only imagine. So my question for you, sir, is what advice would you give to someone who's still in school? Right, who's had a family situation, when they've been diagnosed with Down syndrome, and you've done it, you wear it so well. How can you help them? What would you tell them?
Well, I don't know, but that's a really good question. Just any school I graduated. I don't know.
What would you tell other people with Down syndrome?
Yeah.
I think it's okay, but I think it's perfect. I wanted it make it perfect.
Yeah.
Kind of like me, right?
Mm-hmm.
Like I want to part of this job too.
Yeah,
With
absolutely.
you guys too.
Yeah. And you know what we say back to you, Jack? Perfect. Perfect. Thank you, Chair. And thank you. Thank you so much.
I love that so much. My daughter says that to me sometimes. Perfect mom. I love the perfect baby too, though. I'm going to use that with her now. Assemblyman Hibbets.
Thank you, Chair. If I may have a little latitude in my question. First of all, I'd like to thank you for bringing the bill. I think it's wonderful. My question is actually for Jack. Can you tell me what your lapel pin is?
Oh, I do remember, but this guy just gave this to me. But he's a little bit crazy, but not actually too
Do
crazy.
you remember where we were when you got this? We were
I
here in
got
this
it.
building.
I got it from this here for this building. Is
I think it's Las Vegas Police. And he got it when we were in this building
Awesome.
Well,
doing another.
as a retired sergeant from the Las Vegas Metropolitan Police Department, I would like to commend you on your lapel pin.
Well, I like it. I like your pin too.
Thank you. I'll trade you.
The Assemblyman needs one of those as well. Assemblywoman Newby.
Thank you, Madam Chairwoman, and thank you for being here. I am not familiar with Jack's Popcorn, but I have a feeling I will be very soon. This question is for Assemblywoman May Brown. Brown May. You know, people do that to my name too, and I hate it, and I just did it to you. I'm sorry. In the literature that is referenced here, I'm assuming that there is some standard for this literature. Looking at it, you know, it talks about evidence-based information that's provided. And from our testimony today, we know that that moment can be very overwhelming. And I just want to make sure that, not to necessarily legislate this, but I would hope that the literature would be accessible and understandable and not necessarily overwhelming or further overwhelming for the parents. So maybe you could speak to your experience with literature in this area.
Thank you. Tracy Brown May for the record. Thank you for that question. We went back and forth relative to this specific piece because we wanted to make sure we got it right. And so the last piece is the State Board of Health may adopt regulations, right? So they may have the opportunity to regulate. It would be our wish that a referral to the National Down Syndrome Organization, a local Down Syndrome organization, or Nevada 211, right? So that's our referral source. It could be that simple so that people are not left mourning a baby that could be a beautiful birth for them. So just that easy. We don't necessarily purport to want pamphlets printed out or available in offices. It's not meant to be that way or to be outdated. So simply the availability of the technological resource for a person to be able to go find information. That's our hope. Through the regulatory process, we'll follow that.
Thank you for asking that question. I was going to follow up with that if it wasn't asked at this, by the end of this. I have to say, as a parent, I've had 3 children, and each time birth happens, and you're on your own to figure out how to sleep with that kiddo, how to change a diaper, how to do all the things. There are not a lot of resources out there generally for parents, so I can only imagine when you have other factors weighing into caring for your baby, what that feels like. And maybe this is an opportunity to start looking at how do we support parents better when they are having babies, regardless of how those babies are born. I think that was the last question that I had on my list, and we can move into support testimony. Thank you so much again for being here. It's really great to have you. We'll move into support testimony in our physical location, starting here in Carson City and moving to Las Vegas. Please fill in all of the seats. I'm having a hard time gauging how much support testimony we have here in Carson City. I don't think we need to time it, so I will let you go through your testimony. If you have written testimony, I do ask that you leave a copy with our secretary so that we can get that in the record appropriately. I will ask if you want to go figure out who's going first. State your name for the record. You may begin when you're ready.
Hi, everyone. My name is Catherine Nielsen. I'm the Executive Director of the Nevada Governor's Council on Developmental Disabilities. I am not providing testimony. I am providing support to Miss Alyssa today, and I'll be helping her give her testimony.
Welcome, Alyssa. Please remember to state your full name for the record.
Alyssa Marquez. Alyssa, her intern. She said, my name is Alyssa Marquez, and I am her intern. Alyssa and I spent some time putting this testimony together, so hopefully we can get 3 minutes. That should be good enough for us. So we've read this together, and I'm going to read it on her behalf. So my name is Alyssa Marquez, and I am the intern for the Nevada Governor's Council on Developmental Disabilities. I am 20 years old. I was born in Carson City, Nevada in 2003, and I live in Gardnerville. I love to participate in Special Olympics. My favorite sports are flag football, swimming, bowling, and bocce ball. I've also participated in beauty pageants for 7 years. And last year, I was named queen. I love to draw, play princesses, color with my crayons, markers, and paint. I'm in my second semester at Western Nevada College studying general studies. My favorite classes have been pottery and sign language. I love to go shopping, spend time with my mom, dad, sister, and my service animal, Girl, who has joined us today. I love listening to music and singing to Taylor Swift. I love to go on trips with my family. My favorite trip so far has been to Disney World. I was one of the first people in Douglas County to graduate with an alternative diploma, and I have an ABLE account. When I get older, I would like to work for the state of Nevada in an office. My goal is to join the 700-hour program and gain full-time employment for the state. One day, I'd like to live on my own in my own apartment. I'm working hard to make that happen. I was born with Down syndrome and a congenital heart defect, known as atrial ventricular septal defect. Currently, 1 in 240 babies each year in the United States are born with this heart defect. Many children with and without Down syndrome are born with this same condition. When I was 2.5 months old, I had open heart surgery to correct my condition. Having Down syndrome does not impact my long-term life expectancy any more than a person born without Down syndrome and the same heart condition. It's important that we talk to parents about Down syndrome and the health conditions that may accompany this diagnosis. However, it's also important that we tell them how beautiful their life will be. We must also tell them that they may be born with no medical conditions at all. They must also know that their child, regardless of their Down syndrome diagnosis, will have a beautiful life. Requiring that providers tell parents all aspects of their child's condition, rather than just the negatives that may be. I love my life. My life is valuable. The work I do is important. The last thing I'd like you to walk away with is to remember that my name is Alyssa, and I am downright awesome.
Thank you so much for the testimony and for being here today. And it's not a surprise to me that you've won the beauty pageant. Please go ahead when you're ready. Remember to state your name for the record, please.
Very good, thank you. Good afternoon, Madam Chair and committee members. My name is Ellen Marquez, and my testimony is about 2 minutes and 15 seconds, so I'll get through this as fast as I can. I am from Gardnerville, Nevada. I am the self-advocacy coordinator for the Governor's Council on Developmental Disabilities, but today I am here as a proud parent of a young adult with Down syndrome. I support AB 116 because 21 years ago, when I had an amniocentesis, I was told my daughter would be born with Down syndrome. There was no explanation or information given to me. The only comment was, there are books out there you can read about Down syndrome and what her future will look like. Well, those books were outdated and mostly explained all the medical issues she could be born with and institutionalization. This was disheartening, but I still looked forward to the day I would meet my precious girl. Moving forward to the
to when she was born, the doctor confirmed she had Down syndrome, but otherwise appeared healthy. Later that day, the hospital social worker came in and with no compassion asked, "Is she going home with you?" My thought was, where else is she going? Is someone coming to take her from me? She gave very little information or resources to contact. By supporting AB 116, this will give parents who get the diagnosis of Down syndrome the information and support services to understand Down syndrome is not the end of their child's life, but is the beginning of a new and different adventure. Even though it may be challenging at times, my daughter had open heart surgery at 2.5 months old. They are now part of a diverse and supportive community. Our children are the future of our communities and live long and prosperous lives. They go to school with their peers, learning alongside their friends, and can graduate with the alternative diploma, the parallel curriculum to the standard diploma. They can be employed and attend college. This is what parents need to be aware of when they receive the diagnosis of Down syndrome. My daughter, Alyssa, is a perfect example of what can be for a person with Down syndrome. Thank you.
Thank you for your testimony, for sharing your story today. We have at least one more person in Northern Nevada, or with Northern Nevada, Carson City. Please remember to state your name for the record. You may begin when you're ready.
Thank you, Chair, members of the committee. I will be very brief. You've heard all these wonderful things. For the record, my name is Ashley Cooper. I'm the manager for advocacy and government affairs for Opportunity Village, and we happily, enthusiastically support this bill. Thank you.
Thank you so much. Please remember to state your name for the record. You may begin.
Good afternoon, Madam Chair, members of the committee. My name is Nate Boyack, and I'm on the executive board of SNAP, which is the State of Nevada Association of Providers. Our member organizations provide services to thousands of people diagnosed with developmental disabilities throughout the state of Nevada. Many of our agencies support individuals diagnosed with Down syndrome. We support all educational materials that may be helpful to families looking for community and medical supports related to this diagnosis. Thank you very much.
Thank you for your testimony. Seeing no one else in Carson City, we'll move to Las Vegas. Please remember to state your name for the record. You may begin when you're ready.
Thank you, Madam Chairwoman and members of the committee. My name is Lisa Holmquist, Holmquist, and I am the proud mom of Peter, who is 25 years old, and he has Down syndrome. I am also the founder and CEO of Down Syndrome Connections Las Vegas. We're a 501c3 corporation that helps people in the Down syndrome community, providing education, advocacy, resources, and support. We serve all ages of 0 or prenatal to adult. And we also promote research that helps people with Down syndrome be healthier, live longer, and be fully included in our society alongside all of us. We actively support new and expectant parents through our trained parent mentor teams. They support people who have received a diagnosis either prenatal or as a new parent at birth. We highly support this bill for 2 reasons. The first is that physicians typically don't give a lot of Down syndrome diagnoses in their careers. The incidence is between 1 in 7 or 800 live births are people who have Down syndrome. So it's not something that they're consistently delivering, but we want them to have best practices and support when they do have to deliver the diagnosis, so that the people who are getting the diagnosis feel hope and not fear and are not afraid. And then secondly, one of the things that we consistently hear from our new parents is that they wish they were connected to support groups sooner in the process. This bill would provide information that is updated in one place so that the healthcare professional can provide one-stop shop to give them all of the support groups that are here in Nevada. And so for that reason, we ask you very much to support the bill. Thank you so much.
Thank you, Ms. Holmquist. Not seeing anyone else in Las Vegas. I would ask BPS to check the public line for support testimony on Assembly Bill 116.
To testify in support of Assembly Bill 116, please press star 9 or raise your hand within Zoom to take your place in the queue.
Good afternoon, Madam Chair, members of the committee. Stephen Cohen for the record. Stephen with a V. Cohen as in the Assemblywoman, no known relation. Ditto. Thank you, and I yield.
Thank you, Mr. Cohen. Is there anyone else on the public line for support testimony?
Good afternoon, Chair Peters and the rest of the committee. This is Dora Martinez representing the Nevada Disability Peer Action Coalition. I'm sorry I had to run. I was supposed to be there, but my apologies. And thank you for this bill, Assemblywoman Tracy Brown May and Jack and Ellen and Alyssa. You guys are the bomb. Thank you. I hope you all support this bill. Thanks.
Thank you, Ms. Martinez. Is there anyone else on the public line for support testimony?
Chair, there are no other callers to testify at this time.
We had a couple extra people come up here in Carson City. Are you in support testimony today? All right, we'll go ahead and come back to Carson City. Please remember to state your name for the record. You may begin.
Hello, Madam Chair and Assemblymen. My name is Travis Mills, for the record, TravisMills. I'm here to support this bill, and I'm friends with Jack Rivetti, so I, he does a lot of things for me. He has, being an advocate for myself, he has taught me a lot of things, and he's been really helpful as an advocate for me. And I do a thing called Tennis Buddies, where what it is for people with disabilities. We help tennis buddies. We help tennis groups and how to play tennis, and we have Down syndrome, and we have all sorts of people with disabilities get together and socialize and have a good time, and it's all fun, really fun. And we have also the I Can Bike program, where we help people with disabilities how to ride bicycles. So we have Down syndrome, and all people get together. Thank you so much.
Sign me up for tennis. I'm coming. Please remember to state your name for the record. You may begin.
Thank you. Excuse me. Thank you so much for having us here today. My name is Christina Ugalde, and I'm the Executive Director of the Down Syndrome Network of Northern Nevada. I also have a personal connection to Down syndrome. My nephew, Sebastian, was born with Down syndrome almost 7 years ago. He's going to be 7 later next month. And when they received the diagnosis, it was a very scary time for my sister and her family. And unfortunately, they didn't know about the Down Syndrome Network. I wasn't there at the time for a while. It was probably a year, maybe 2 years before she connected with the network. And since she found them, I started volunteering. I've joined the board, the executive board, and now I've turned it into my passion, my career. This is what I do because I'm so invested in making sure that my nephew lives a full and happy life, because everyone deserves that chance. And to know that if she could have gotten the information a little bit sooner, she could have been connected to this network that provides so many amazing resources for families and all of the other resources that are available in the community. We want people to start their lives with as much hope as they can. And this bill is going to help a lot of people, and I hope that you pass it. So thank you.
Thank you. In this support testimony, we've created a pretty good list of resources that should be available to folks. Thank you both for your testimony. Is there anyone else in our locations that would like to provide support testimony before we move on to opposition testimony? All right, I'll go ahead and open opposition testimony in our physical locations. If you would like to provide opposition testimony to Assembly Bill 116, please come up to the desks. Seeing none, BPS, is there anyone on the public line that would like to provide opposition testimony on Assembly Bill 116?
To testify in opposition to Assembly Bill 116, please press star 9 or raise your hand with Zoom to take your place in the queue. Chair, there are no callers to testify at this time.
Thank you so much. We'll go ahead and move into neutral testimony in our physical locations. Is there anyone in Carson City or Las Vegas who'd like to provide neutral testimony on Assembly Bill 116? Welcome. Please go ahead and remember to state your name for the record. You may begin.
Thank you, Madam Chair, committee members. My name is Sarah Watkins. I represent the Nevada State Medical Association. We share the sponsors' goals of this bill. Children and their families should have access to any and all resource information. We're not sure the mechanism is in the bill is the best way to get the information to the family, and we plan to sit down with the sponsor to discuss it more. Thank you.
Have you had the opportunity to meet with the sponsor
Yes,
yet?
we've been talking with her, yeah.
Okay, all right. Thank you so much.
Thanks.
Is there anyone else in the physical locations for neutral testimony on Assembly Bill 116? Seeing none, BPS, is there anyone on the public line for neutral testimony on Assembly Bill 116?
To testify in neutral for Assembly Bill 116, please press star 9 or raise your hand in Zoom to take your place in the queue. Chair, there are no callers to testify at this time.
Thank you so much. I'll go ahead and invite the bill sponsor and her co-sponsors to the table for final remarks.
Thank you. We just would like to offer our sincere thanks for having the opportunity to present this bill and for talking about how wonderful people with Down syndrome are. So we look forward to following up later. Thank you.
Thank you so much. And I may miss you, Jack, before you leave, but I would love to attempt to connect the dots, and maybe you are the Jack from my class. Thank you again so much. We'll close the hearing on Assembly Bill 116 and move on to Assembly Bill 179. We're going to let folks get situated real quick. Our own Assemblywoman Gorlo is heading down to the table. And you know the drill. Remember to state your name for the record. You may begin when you're ready.
Thank you very much, Chair Peters. For the record, I'm Michelle Gorlo. I represent Assembly District 35, and I believe we have Dr. Irie on Zoom, so I just want to make sure. Oh, there he is. Okay, great. I'd also like to take a moment to mention that I'm also the immediate past chair of the Southern Nevada Maternal Child Health Coalition, also known as MCH Coalition, past chair of the Nevada State MCH Coalition, and currently sit on the MCH Coalition Steering Committee. I was also a member of the Governor's Association on Improving Birth Outcomes and the Nevada State Collaborative Improvement and Innovative Network, also known as COIN, for 3 years. Maternal child health is kind of my thing, so I'm excited to be here. I will try not to take too much time because I can talk a lot about this subject, and I know we have 2 other bills on the agenda. So it is my extreme pleasure to present Assembly Bill 179, which aims to establish a perinatal quality collaborative in Nevada. And as I mentioned, with me today is Dr. Brian Irie. He's president of Hera Women's Health, a national collaboration of top women's healthcare providers, and he's also the managing physician of High Risk Pregnancy Center. Dr. Irie and I have known each other for about 15 years, which is really odd since we're both only 29. And it's my honor to be working with him on this very important piece of legislation to improve the health of moms and babies. He'll be providing some background information on what a perinatal quality collaborative is. And he'll be doing that after I do a little bit more background on maternal child health. So in the average week in Nevada, 647 babies are born. Of those, 72 are born preterm. That's over 4,000 preterm births a year for a baby in Nevada, which equates to about 11.2% preterm birth rate. That gets Nevada a D- grade on the March of Dimes report card. Las Vegas is doing even worse. They have an F grade on the report card with an 11.6% preterm birth rate. The Nevada preterm birth rate among black women is 39% higher than the rate among all other women. And in 2020, 156 infants died, which translates to an infant mortality rate of 4.6 per 100,000 live births. However, I do want to point out that that was an abnormal decrease for Nevada in infant mortality. In 2009, it was 5.7, and in 2018, it was 6.2. The national average is 5.4. And in the exhibits, you can see that information in the Nevada report card. So that should be in your exhibits. Nevada ranks poorly for women and babies' health outcomes overall, too. For example, between January 2020 and December of 21, there were 1,168 identified severe maternal morbidity cases in Nevada. The rate of severe maternal morbidity increased between 2016 and 2021 from 126.5 to 205.6 per 10,000 deliveries. Severe maternal morbidity is thought to be 60 times greater than that of mortality, and there are dramatic increased costs for that. Nevada also has one of the lowest family medicine, pediatric, and gynecological physicians per capita nationwide, as well as a high percentage of women who are uninsured during pregnancy. And research demonstrates that the major cost result from subsequent neonatal care and not from pregnancy itself is the hugest factor. This suggests that we need to concentrate efforts on improvements in perinatal care to prevent unnecessary catastrophic outcomes for moms and babies and reduce overall care costs as well. AB 179 is about establishing a statewide perinatal quality collaborative, which typically focuses on identifying and implementing evidence-based practices that address gaps in patient care. These may include practices related to prenatal care, labor and delivery, neonatal care, and postpartum care. Collaboratives also work to establish standard protocols for care and to identify and address variations in care across different healthcare facilities. At this time, I'd like to turn it over to Dr. Brian Irier so he can talk a little bit more about the collaborative, and then I will go over the bill and the amendment.
Thank you. Welcome, Dr. Irier. Please remember to state your name for the record. You may begin. We're not hearing you. And Carson, did you turn the mic on? There's a little mic button in front of you, little white button.
Hello, Brian Irier, Las Vegas, Nevada. I'm here to support AB 179, and thank you, Madam Chair, and also other committee members for letting me speak. I wanted to go over this in a little bit of detail for you so you really understand what a collaborative does and what it doesn't do, and the positives of what a collaborative can create for Nevada, as we are one of only 2 states out of 50 in the country that do not have a collaborative. My background is varied. I was the former president of the Society for Maternal Fetal Medicine in the United States, which is the largest high-risk pregnancy organization in the world and the most prestigious. I'm the president also of Hera Women's Health, which is a national integrated healthcare model. I've been the director of 2 national workshops in the United States, the only one to be more than one. I'm the author of over 25 research articles and currently serve as the primary national investigator for the PRIME trial, which is a $20 million funded study in the U.S. Why do we need a collaborative? Well, we need a collaborative basically because of what Representative Gorlow was talking about in the U.S. maternal mortality rates. If you look at it in the teal at the bottom, the maternal mortality rate in and this was like in 2017, 2018 was 17.4 per 100,000 births. If you compare us to other developed nations, we're at least double the average and in some cases triple that. And we also have a high spend on what we do as well. And that creates a big issue and a big problem. Furthermore, when you look at maternal mortality in Nevada, we used to be a little bit better than other places in the country. But if you see, we are the blue and the United States is the orange. You can see the relative increase in maternal mortality in Nevada over the last decade. And this actually gets even worse when you compare this to the uneven burden of U.S. maternal mortality in African American women, who have a disparity of 2.9 times the maternal mortality of African American women and higher than that of Hispanic populations as well. The CDC states this is reasons of variation in healthcare, underlying chronic conditions, and structural racism and implicit bias. But to bring another example to you that might hit home, everybody knows the story of Serena Williams, who basically had, who, if she did not stand up for herself and had a history of pulmonary emboli in the past, was not placed on medications after delivery to prevent it from recurring, and then had a recurrent pulmonary embolus, and she had to beg and plead for her to be started on medications to save her life, and thank God she did. But in Nevada, our problems are even worse. You know, we have this pregnancy-related mortality rate by race, 63 per 100,000 in the United States. This is the highest rate of African-American maternal mortality in anywhere that records this number in the United States. So we have an immense racial disparity as well. Representative Gorlow was talking about cost and was talking about maternal morbidity. We have a health and equity issue, but we also have a cost issue as well. And since 50% of almost all births are Medicaid related, this is a big issue for our state. With severe maternal morbidity, it's 60 times greater. If you look at the costs, and this is, I believe, from the Commonwealth Fund, it's a slide from them, and this is almost, this is 2013 data, so over a decade ago. The disparity in cost is 40%, and these numbers have only probably doubled since that time. So what does a collaborative do? You know, it's basically just a statewide team of people that are involved to work to improve quality of care of pregnancies. What they do is they look at key healthcare and quality processes and use evidence-based practices to kind of push forward methods to improve and make changes. And we really need this in Nevada because we have to improve quality, which will improve outcomes, which will decrease cost. Also, when you put things that are in place that are protocols, you take the judgment and the implicit bias out of issues, and you decrease racial disparities as well. So I'd recommend that this eventually be considered as a mandatory participatory process for all of our hospitals in the state. As stated before, we're one of only 2 states that don't even have a collaborative or one that's actually in the formation type of process. I've been before the legislature now for almost 5 years trying to push for this collaborative. Earlier, there was about 16 states without one. Now we're in the final 2. We didn't move on a maternal mortality review committee until Nevada received a grant, and that put us way behind in looking at this for the processes in our state. As I said, you know, collaborative, all it is a group of expert healthcare people, providers, public health people, patient advocates working together to improve quality and safety for mothers and babies during pregnancy, childbirth, and the postpartum period. We need it because adoption of care is slow, and I want you guys to really hear this. The average time it takes for when something is the standard of care in a research article for implementation, for 50% of people to implement it, is 17 years. 17 years. So what collaboratives do is they take this modern information, push it forward, and get it into places that are needed. And in obstetrics and gynecology, this is really even more exacerbated because many of the OBGYN groups are 1 people, 2 people, 3 people, and you really don't have teams pushing things together for women on a larger basis to get things done. I want to go over a little bit of the successes of collaboratives in other states and why 48 states really have one, okay? This is the California Maternity Quality Care Collaborative Model. They started in 2006, if you look at the slide. And then the U.S. rate of maternal mortality is in the red and California's is in the blue. 1/3 the rate of maternal mortality in California. And they have the data now up to 2016. And their maternal mortality rate is now 5.9, I believe, in 2016 is their data, while the U.S. rate at that time was about 23. So this is something that you can see has worked in other places. I want to go forward, though, and give you a little bit of specific examples of what they do and what they don't do, because I think people misunderstand what collaboratives do. They think they might get involved in processes that are more natural, and they're not. They're evidence-based and move to create care that is improved and to decrease disparities. And I don't think anybody is really against improved care and decreasing disparities. So what the California Maternity Quality Care Collaborative did is they put out a hemorrhage protocol. Hemorrhage used to be the #1 cause of death for women in the United States about 15 years ago. Now it's #4 because these many collaboratives put together a hemorrhage protocol. So what they did is develop a detailed means of documenting hemorrhage. Sounds silly, but people used to estimate hemorrhage. Now they document hemorrhage, which allows earlier diagnosis and treatment, and then they have treatment protocols for that. They reduced their maternal mortality from hemorrhage by 36% and reduced maternal morbidity, which is a cost driver, by another 21%. In Ohio, they implemented an antenatal steroid protocol. Steroids are used for babies at increased risk of preterm delivery, and when those are given, they're just a single shot or 2 shots, and those are given, they actually accelerate lung development in the fetus. And if babies get them 2 to 7 days prior to delivery, their lung development is greatly increased. And in Ohio, they had a steroid use that was increased, and they decreased respiratory distress in infants by 14%, which also decreases NICU rates, and NICU costs are immense and are their main driver of cost. In Texas, they had a Alliance Innovation in Maternal Health, or AIM, Perinatal Quality Collaborative, and they put in a hypertension protocol. Well, about 15 to 20 years ago, a study came out that if you were treated quickly with antihypertensive agents to decrease people with severe blood pressure, you basically eliminated almost all death from stroke in these women. So they developed this protocol to treat severe hypertension. And hospitals that implemented this protocol had a 34% lower incidence of severe maternal morbidity related to hypertensive disorders, again, decreasing costs as well. Illinois also had a similar decrease and result in decrease in costs. There's a National Alliance for Innovation in Maternal Health that's under the American College of OBGYN. They also put out some protocols for these states to use. And they found that hospitals that implemented an obstetric hemorrhage protocol to decrease postpartum hemorrhage had a 21% lower incidence of severe maternal morbidity when compared to other states, other hospitals that did not. Again, that shows that this data not only happened in California, but it's reproducible state to state and where it goes, which is super important for us to know that if we did something like this in our state, we'll probably get similar results. In New Jersey, another implementation of a hemorrhage protocol and a hypertension protocol, and they had a 50% reduction in maternal death and a 29% reduction in severe maternal morbidity. So you could see that these protocols that you put in place actually save lives, decrease morbidity, and decrease costs, and hopefully also decrease disparities. But they also can go into other realms as well. Texas also initiated a breastfeeding protocol, and they had a 5% increase in exclusive breastfeeding and a 15% overall increase in breastfeeding. The Michigan OB Safety and Improvement Program, their collaborative, implemented a protocol to reduce early elective deliveries prior to 39 weeks, and they've decreased that from 27.5% to 4.5% and decreased NICU admissions by 30% from 9.9 to 6.8%. Again, NICU is a major driver of costs. The New York State Perinatal Quality Collaborative implemented a neonatal safe sleep program, which decreased the rate of sudden infant death syndrome. I think in our state, we could develop a standardized protocol for the treatment of neonates exposed to opioids, and we would probably have a dramatically decreased savings in NICU costs. The average baby that's taken care of with opioid use disorder spends 16 days in the neonatal intensive care unit at an average of about $10,000 a day. In one of our hospitals in Las Vegas that has a great protocol, they've decreased that to an average of 4 days, a 12-day savings. So that's something we definitely can do. So just kind of winding down, what do collaboratives do? They identify and prescribe protocols for high morbidity and mortality cases and decrease them by addressing the root causes. They look at inconsistencies in care and emergency situations that lead to poor outcomes to try to drive down disparities by helping to standardize processes, increase system readiness while following evidence-based guidelines, which takes 17 years to get out to the population. They increase collaboration. When people work together, we know as we work as a team, we all do better. Perinatal care has a wide range of providers that are in smaller groups: OBGYNs, midwives, neonatologists, nursing staffs, large and small hospitals, rural and urban centers. Quality collaboratives raise all boats by collaborating with each other and improving communication and teamwork. It'll also allow us to get data, and when you get data, that allows you to drive improvement as well. There's this thing called Plan, Do, PDSA cycles, which is Plan, Do, Study, Act. So that's what you do. You get the study, and then you act, and then you plan again, and then you do. So you create a constant improvement process. And they would also decrease NICU or overall costs by decreasing maternal morbidity and NICU admissions. And remember, 50% of all of our births in the state are Medicaid related approximately. So what do they really do well? They get evidence-based practices on scientific research, collaborate providers, share resources, and promote cost effectiveness. In the United States, CMS is now asking 2 questions of all hospitals for births now. It's a 2-part question. Does your hospital or health system participate in a statewide or national perinatal quality collaborative? We'd be one of 2 states to be saying no to that question every time. So we're late to the game, but it's time for PQC formation because it's constantly asked now by CMS, and that'll drive hospital participation as well. As I stated, Nevada was one of only 14 states without a perinatal quality collaborative in 2019. There was a picture here. I'm sorry, it was us on an empty road by ourselves. Did not come over. Now we're only one of 2 states without a perinatal quality collaborative. So I'm really asking for your support. I'm asking to support Assemblywoman Gorlo's bill because maternal mortality and morbidity is too high and preventable. Healthcare inequities need to be addressed. Major costs to the system and from subsequent neonatal care can be lessened, and it really focuses on evidence-based medicine and not natural birth processes. We need to concentrate efforts on improvements in pregnancy care to prevent unneeded catastrophes happening within our current system. And I need everybody to remember that although you spend on these things, spending on pregnancy is really the ideal preventative cost savings because it treats 2 patients for the price of 1 and alters a lifetime of health for a baby in the future and to have a baby that has a mother in the future. So I want to say that pregnancy care overall is value-based care. And I really not only ask for your support, but 4 years later as a physician, I'm begging for your support on this bill. And for that, I thank you for allowing me to have this time.
Thank you, Dr. Irier. Before we go into the bill language, I think everyone on the committee has had ample time to review the initial bill language. So if you would go over the changes proposed in the amendment, and then we can move into questions, I think that's the best way to do this. Please go ahead.
Thank you, Chair Peters. And for the record, Michelle Gorlo, representing Assembly District 35. What I do want to kind of really talk about is what this collaborative is not. We've received some emails and there's been some misunderstandings on what it is.
Dr. Irier, would you mind turning your microphone off? We're getting a little feedback from you. Thank you.
Again, Michelle Gorlo for the record. This does not dictate how or where a woman gives birth. This is just to make sure that wherever she decides, she has the safest birth for both her health and her baby's health. This is not a special interest lobbying group. This is actually something that I brought when I worked with the March of Dimes back, I believe it was 2009 or 2011. That time I was doing a lot of perinatal quality work as well as that 39-week delivery, the elective deliveries before 39 weeks. So this has been around for a little bit. Section 2, I do want to, just want to point out that the control collaborative, that will be stricken from all of it. It's just a perinatal quality collaborative. Section 3, I have changed that the collaborative may consist of the following members. That's to give a little bit of flexibility on who would be in the collaborative. Also, we have added and changed a couple things on, I believe it's E, the Dean of the School of Medicine at UNR. We are also adding UNLV or another accredited School of Medicine within Nevada. And again, it could be 1, it could be 3 or 4. This is up to the collaborative. During regulation, they can decide how many. The one thing I don't want is to have a collaborative of 100 people that makes it defunct. Again, it's in regulations that they can determine these items. We're also, and I think I've got it as J in mine, I tried my best to make it all color-coded and pretty, but I didn't do a very good job. That's why we have legal. So they'll make it look better, but we're adding to make sure that there is a representative that is a perinatologist. It mentions obstetric and gynecologist, but it doesn't mention a perinatologist. I said a representative of each hospital system, again, to take some of the burden off of some of the hospitals. But again, as Dr. Urier pointed out, we would like them all to participate, but it's a flexibility. We want to make sure that it's flexible for them. And a representative from at least one birthing center. So we have those voices. I did have some questions about why a mom was not on here. That is a voice that should be put on here at some point, but again, one that it doesn't limit them, that they can't be on. But when I was speaking with Dr. Urier, usually in the beginning stages, because this is medical, there's not that voice yet. Later on, it is put on. So that is something, again, it's flexibility. So going over my notes, let's make sure I got everything else. I did want to quick point out in section 310 that the collaborative may apply for and accept grants, gifts, and donations. That was something that was brought to my attention from someone. They were concerned about that. Some of this can be funded through CDC. CDC currently funds, I believe it's 27, but South Dakota is kind of in a gray area, so sometimes they're included in the funding, sometimes they're not. I'm not quite sure why. Back to section 3, number 9. The meetings of the collaborative are closed to the public. This is in line with several other organizations, and I wanted to talk a moment about that. We're talking about very sensitive information. This is medical information. It's HIPAA related. The maternal mortality review is also closed, and so I'm looking at the exact same language that group has for their closed meetings. And I kind of want to bring up a point that last week I was talking about 2 separate people. One was a pregnant woman. One was a child that I had worked with in early intervention. To 2 separate people. I did not mention their names, but based on some of the vague information I gave, they both knew who I was talking about. I don't want people to be able to figure out the sensitive information that we may be talking about whether it's a mother who had passed or had a severe complication. That's a HIPAA violation. So I wanted to put that on the record. That is why this is closed. However, we are adding in, just like the maternal mortality review, we're adding in a section that they have to come back and report to the interim Health and Human Service Committee, and also their findings need to be on the website, the same website that the maternal mortality review has their report. So those findings will be available for people. This is not trying to hide anything other than sensitive personal information. And we'll also be adding a section, I'm not quite sure if it's 7 or 8, but the effective date. This will be effective upon passage and approval of adopting any regulations and performing any other preparatory administrative tasks that are necessary to carry out the provisions of this act, and 2, on January 1st, 2024 for all other purposes. And I modeled that also after maternal mortality review language. I think that is all the review I have for this. A lot of it is already in statute, so I am available, as well as Dr. Urier, for any questions.
Thank you so much for the presentation. We have a couple questions. I have Assemblywoman Gonzalez first. Please go ahead.
Thank you so much, Madam Chair, and I can't see over. And thank you so much for the presentation. And thank you, Dr. how do you say? Erie for the informative slideshow. A lot of my questions actually were answered in this slide presentation. But my question is, so we've talked about all the great things that all of these other boards have done in other states. Is there anything in the bill that talks about if folks don't comply with the recommendation or the, what was the word that you used? Sorry, the protocols. So if anyone doesn't want or doesn't adhere to the protocol recommendation, what does that look like? Thank you.
I'll answer that. Usually, this is something that it raises all boats. I will tell you, as a general rule, and you probably remember it from college, there was nobody worse than the pre-med student who wanted to get ahead of you for their grade. It's the same thing for physicians, and it's the same thing for people in hospitals. Their data will go out on these studies and protocols, and they'll find people who are above average, and they'll find people that are below average. And the people that are below average always want to try to do better. And then also the people that are above average are now in a position where they can help others and give them opportunities on why something might have not been as successful in one area as another. So there is nothing to, this isn't about, I think, a punishment. This is more about trying to lift all boats by putting protocols in place, education in place, and having collaboration to make everybody get assistance.
Please
Could I add to that real quick?
Assemblywoman Gorlow, please go ahead.
Assemblywoman Gorlow, for the record. Sometimes also when these protocols are put in place, the insurance companies will put in some restrictions on payment. And for example, the elective deliveries prior to 39 weeks, if there wasn't a reason to deliver a woman and they were just doing it because she liked the really cool birth date, which did happen in the early 2000s. There was a lot of designer birthdays. They just wouldn't pay for those births. So there are ways to also prohibit bad behavior.
Thank you so much. And just as a follow-up, so I'm understanding correctly, so this board of folks would make a protocol and then the protocol would then be mandatory? Is that correct?
Dr. Uriel, turn this over to you.
The protocol would be prescribed, okay? So there's two things about protocols, right? One is they're educational. So when you have a protocol in place, now the physician, the care team knows the one best way of taking care of something, all right? And then they will end up following that protocol. When you don't have protocols, usually what happens within hospitals is if you have fallouts from protocols, then you will have meetings about why people fell out of the protocol and why they shouldn't fall out of the protocol and how to prevent that in the future. So, you know, it's something that when you see protocols, everybody is trying to get them to 100%. And I guess what you're saying is like can people say, yeah, they don't want to do them? Sure, they could, but usually what happens in a hospital, if something is best evidence-based and the hospital agrees that it should be done a certain way, if somebody doesn't follow it, it usually goes through an internal committee process within the hospital, and then the physician or the care team needs to explain why they didn't follow the protocol, and that usually ends up handling the circumstance.
Thank you for the response. I have another question from Assemblywoman Taylor.
Thank you, Madam Chair. Thank you, Doctor, and thank you, Assemblywoman Gorlow. Thank you for bringing this forward. And the stats, especially for women of color, and in particular African-American women, no surprise, but it's always just kind of another wake-up whenever I see them in front of us. So this is certainly we want to protect all children, all births, and mothers in births as well. In particular those who are most vulnerable. My question is this: it's kind of connected, I think, to where Assemblywoman Gonzalez was getting. So in this bill, does this bill make anybody do anything other than the creation of the collaborative and then hiring of the executive director?
I will tell you this, in all the places around the United States that have collaboratives, none of the collaboratives make anybody do anything. What happens happens is when you put a protocol in place, doctors follow protocols. Because actually it makes your life easier to follow a protocol, right? Because the order set is already there. It's in the computer. You don't have to order anything. You say, institute the hemorrhage protocol, and it goes step by step through it. And then it's also done in a way that's much more rapid. So everybody realizes that they're for improved outcomes. And then whenever people have fallouts from protocols, we actually have a protocol at one of our hospitals right now. And the people that are falling out are getting exactly what I said. They end up going to committee and they end up being asked why they're falling out of protocol and how they cannot fall out of protocol and why that's below standard of care for evidence-based practice. And then later, if that continues to happen, what happens is they could be sent for remedial education or they could be taken off staff. But that's not where you want to go. Where you really want to go is you want to educate people to make them better. You want to make them understand why they're falling behind and to raise all boats. So that's the idea of a collaborative, is to not be a strong arm, but to be something that lifts all boats.
Thank you, Doctor. Thank you, Chair.
Thank you for the question and response, Dr. Urier. Assemblywoman Newby, do you have a question?
I do. And thank you, Assemblywoman, for this bill. I think it's long overdue. I was wondering where will you be, or where will the collective be getting the information from? Is it just from hospitals, just from the birthing centers? What about births that occur outside?
I'll go ahead and take this, Dr. Urier. For the record, Michelle Gorlow. This is actually the working arm of other groups, such as the Fetal Infant Mortality Review, the Maternal Mortality Review, Child Death Review down in Las Vegas, which actually does look at fetal demise as well. So it's going to take their findings. They're going to say, hey, this is a problem. This is a working arm. They take those problems and they'll be looking at the aggregate data to make those decisions on protocols. And I just kind of want to bring up a point what Assemblywoman Taylor had mentioned about the racial disparities. In 2003 is when the March of Dimes launched the prematurity campaign. We received our first report card in 2008, which was 2006 data. At that time, Asian Americans had the lowest preterm birth rate. And it stuck in my head because I'm trying to plan out what I'm going to do program-wise to target certain groups. And I thought to myself, oh great, they're already below the goal preterm birth rate, which was 7.4% at the time. Those numbers have changed, but that's another story. But I already thought, I don't have to worry about them. They're doing great. I can spend my time targeting African American women and Native American women. They're now the third highest. I would hope at some point that these groups that are looking at morbidity and mortality might find a reason that they are now the third highest, because I have no idea, and I've been asked that numerous times, why I think that they're now the third highest. I don't know. So I'm hoping these groups can look, and then again, this collaborative will be able to go out and make those changes.
Thank you. Are there other questions from the committee? You answered mine. So, okay, we can go into testimony. We'll go ahead and start with support testimony on Assembly Bill 179 and our physical locations, and then go to the phones. Please go ahead and come up and fill in the seats as they're evacuated, and you can remember to state your name for the record. You can begin when you're ready.
Chair Peters, members of the committee, my name is Connor Kane, and I'm here to testify in support of Assembly Bill 179, which, as you know, establishes the Perinatal Quality Control Collaborative on behalf of HCA Healthcare. We take great pride in caring for many of the most vulnerable babies throughout the state at Sunrise Children's Hospital's 72-bed neonatal intensive care unit, which is the largest and most comprehensive in the entire region. Many of you have had the privilege of visiting the NICU at Sunrise Children's Hospital and might remember seeing babies weighing just a few pounds that are sometimes experiencing withdrawal from illicit drugs they're exposed to in the womb before birth. Hearing those babies cry is absolutely gut-wrenching. The team at Sunrise works miracles not only to comfort these babies, but also to provide life-saving care. We applaud the goals of this collaborative to work on issues like the one I just described by decreasing the number of infants born with neonatal abstinence syndrome, and urge your support of Assembly Bill 179. Thank you.
Thank you. Please go ahead.
Thank you, Chair and members of the committee. Blaine Osborne, Nevada Rural Hospital Partners, for the record, here in support of AB 179. Sadly, only 3 of our critical access hospitals in the state still offer routine delivery and obstetric services. Those occur in Fallon, Winnemucca, and Ely. All 3 of those be represented on this collaborative. We're happy to be participating and engaged in these important discussions. Thank you.
Thank you. Please go ahead.
Good afternoon, Chair Peters, Jesse Wadhams, here today representing Pediatrics, which is the largest provider of NICU services to Nevada's preterm babies, including 12 years ago, both of my 9-week preterm sons. So we are proud to support Assemblywoman Gorlow's bill and AB 179. I won't reiterate the many benefits you've heard about collaboration in this space. Pediatrics uses collaboration across its practice units and has seen the driven benefits of care across its entire operations. So we appreciate this bill. We appreciate your consideration of it, and thank you for your time.
Thank you. Please go ahead.
Thank you, Chair Peters. Alex Tanchek with Silver State Government Relations, representing the Nevada Advanced Practice Nurses Association. NAPTA wishes to support AB 179 and believes the work of this collaborative can help inform the care of mothers and children throughout Nevada. We also want to extend our appreciation to Assemblymember Gorlow for the inclusion of the certified or professional nurse midwife on this collaborative. Thank you.
Please go ahead.
Good afternoon, Madam Chair, committee members. My name is Sarah Watkins. I represent the Nevada State Medical Association. We are here in support of AB 179. We want to express our gratitude to the sponsor for meeting with our team and taking our initial concerns into consideration. We have several members who serve on the existing Maternal Mortality Committee and Child Death Review teams. The amendment tailors the focus to prenatal health, which is not currently reviewed by the existing committees, but is certainly an important public health topic worthy of formal review. Additionally, this bill promotes dialogue among the committees, which is important in painting a full picture of the individual's life under review. We thank you for your time and the sponsor for bringing this bill forward.
Thank you. Please go ahead.
Thank you, Madam Chair, members of the committee. For the record, my name is Katie Ryan, and I'm with Dignity Health St. Rose Dominican, here today with my asthma cough. But we're here in support of AB 179. Just wanted to echo what my colleagues before me have said, and Dr. Irier. It's, I think, really time for us to pass this bill. Thank you.
Thank you. Please go ahead.
Good afternoon, Tess Opferman here on behalf of the Nevada Women's Lobby and the Human Services Network. I know that you've got quite a bit of testimony and more bills to come, but we do urge your support, or we do support this bill and urge you to pass it and join the 48 other states that already have collaboratives. Thank you so much.
Thank you. Please go ahead.
Hello, Elise Monroy Marsala with Bell's Case Government Affairs. I'm here today on behalf of 2 of our wonderful clients, the Children's Advocacy Alliance that supports this bill, as well as the Nevada Public Health Association. The PQCCs are an evidence-based strategy, which the Nevada Public Health Association supports. As Dr. Irier mentioned today, these collaboratives have been shown to decrease the number of premature births and maternal mortality. Also, the Nevada Public Health Association is actually named as a member in the bill and look forward to helping to do this really important work to improve health outcomes for all Nevadans. Thank you.
Thank you. Please go ahead.
Hi, good afternoon, Madam Chair and members of the committee. Thank you, Assemblywoman Gorlow, for bringing this bill. I'm here today, Leah Case, here today on behalf of the Nevada Psychiatric Association. Several of our members are very interested in working with this collaborative. They work in the high-risk pregnancy center. They're working with women who are pregnant and dealing with substance use issues or serious mental illness, and this will be a good step. And also, Nevada should not be the only state without this collaborative. Thank you.
Thank you so much. Seeing no one else approaching the desk in Carson City and no one at the desk in Las Vegas, I'll ask BPS to check the public line for support testimony on Assembly Bill 179.
To testify in support of Assembly Bill 179, please press star 9 or raise your hand in Zoom to take your place in the queue.
Good afternoon, Chair Peters and committee members. For the record, my name is Paula Luna, Operations Manager at Battleborn Progress. We're in support of AB 179, and we thank Assemblywoman Gorlow for spearheading this critical measure. This bill establishes a perinatal quality control collaborative, which will be responsible for finding measures to reduce premature births, maternal morbidity, and infant mortality. We know that the maternal mortality rate for women of color is disproportionately higher than it is for white women, and we are happy that one of the objectives of the collaborative is to reduce this disparity, and hopefully this will lead to less maternal mortality for women of color. This measure is one that is necessary steps to further ensure that this body prioritizes maternal and infant health now and for future generations. We urge this committee to support AB 179. Thank you.
Thank you. Next caller, please.
Caller, you may begin.
Can you hear me?
We can. Please go ahead. State your name for the record. We lost the caller. BPS, is there anyone else on the line for support testimony?
Caller, please press *6 to unmute your phone.
Technical difficulties. Are there other folks on the public line for support testimony?
Chair, we are having problems unmuting this caller. Let me try one more time.
Thank you.
Caller, please press *6 to unmute your phone. If you have recently joined to testify in support of Assembly Bill 179, please press *9 to take your place in the queue.
I think we're going to come back to BPS. We'll go through opposition testimony and check back in at that time for both support and opposition on the phones. We'll do opposition testimony in person in Carson City and Las Vegas. Is there anyone who would like to provide opposition testimony to Assembly Bill 179? Please come up to the table. Remember to state your name for the record.
Good afternoon, Madam Chair and members of the committee. My name is Kathleen Palmer. I live in Carson City, and I have several concerns about AB 179. It is redundant. We already have two boards that address these issues: the Maternal Health Advisory Board and the Maternal Mortality Review Committee. I am concerned about the lack of transparency this board will have. AB 179 states that the board will meet in private. That means that citizens will not be able to review the proceedings, even though we, the taxpayers, would be paying travel expenses and per diem allowances for the participants. Data should be anonymized enough to be in compliance with HIPAA so that the meetings can be shared with Nevadans. I am looking for transparency and accountability from my government. Thank you.
Thank you for your testimony. Is there anyone else to provide opposition testimony on Assembly Bill 179? Seeing none, we'll go back to BPS to check in for first opposition testimony, and then we can go back to support testimony. Are there callers on the line who would like to provide opposition testimony to Assembly Bill 179?
Callers, if you have recently joined and would like to provide testimony in opposition to Assembly Bill 179, please press star 9 now to take your place in the queue. Again, if you would like to testify in opposition to Assembly Bill 179, please press star 9 now.
Good afternoon, Chair and esteemed members of this committee. My name is Nancy Jones. I am a resident, a resident of Nevada, a parent, and a board member of Health Freedom Nevada. We are a nonpartisan, grassroots, 100% volunteer organization representing approximately 5,000 Nevada families, and we serve as the Nevada affiliate of both Children's Health Defense and Stand for Health Freedom, national organizations whose missions align with ours. Our founding principles include the right of every citizen and every parent or guardian in the case of a minor child to true and full and informed consent to any and all medical and pharmaceutical interventions, to religious freedom and parental rights in all personal health care decisions. We oppose AB 179 because it increases the opportunity for regulatory interference on the private practice of medical doctors and midwives in the state of Nevada. Personalized care, with the patient having a voice and acting as an informed advocate for herself or himself, is essential. Health Freedom Nevada is in favor of improving health outcomes for all babies and mothers across the state. Yet we oppose this being pursued by a state-endorsed collaborative that takes its cues from the pharmaceutical industry, federal bureaucracies, and the private organizations with their own agendas. In particular, we wish to make it clear that we oppose having federal bureaucracies of unelected officials, such as those at the CDC, be given preferential influence in the affairs of practitioners in the state of Nevada. We are also in opposition to this bill because the proposed collaborative would be devoid of representation from mothers in the state of Nevada, and the meetings would be closed to the public, and the collaborative would be given private medical data and wide license to enact its overly broad commission. We urge you to oppose this bill. Thank you.
Thank you. Are there other callers in opposition?
Hello, my name is Katie Banuelos. That's Banuelos. I'm here representing the Libertarian Party of Nevada in opposition to AB 179. I'm also speaking as a mother of two who chose home birth with the support of a midwife rather than going to a hospital and exposing myself to a far greater risk of intervention. This proposed collaborative threatens to place an unwanted regulatory burden upon midwifery and mothers in our state. Its entire purpose is to develop and push down a top-down set of standards of care. This threatens to harm alternative practitioners and mothers who choose to have their prenatal care and birth take place outside the traditional hospital setting. There's also no guarantee that the collaborative will have the right answers. With centralization of authority comes the risk that bad ideas are forced on everyone. There isn't always one best way to take care of everyone because every person and situation is different. Giving one entity the authority to dictate protocols for everyone is inherently risky. Any recommendations should be optional, and practitioners should be free to follow their conscience without penalty. Childbirth is a deeply personal experience, and every mother should have the right and opportunity to seek the care and provider best suited to her needs. We urge you to vote against this proposal, or at a minimum, amend the bill such that its governance authority applies solely to hospitals and will not impact midwives or mothers who choose alternative birth arrangements. Thank you.
Thank you. Are there other callers in opposition? Oh, please go ahead.
Sorry, Chair. Callers, all hands were previously lowered. If you would like to testify in opposition to Assembly Bill 179, please press star 9 at this time or raise hand in your Zoom window to take your place in the queue. Again, if you would like to testify in opposition to Assembly Bill 179, press star 9 or raise hand in your Zoom window. Chair, there are no other callers choosing to testify in opposition at this time.
Thank you so much. I'd like to open support testimony on the phone lines again. Can you check and see if there's support testimony on Assembly Bill 179 on the phones?
Yes, Chair. Callers, if you would like to testify in support of Assembly Bill 179, please press star 9 or raise hand in your Zoom window to take your place in the queue. Again, if you would like to testify in support of Assembly Bill 179, please press star 9 or raise hand in your Zoom window now. Caller with the last 3 digits, 985, you are unmuted and may begin. Caller, you are unmuted on our end. Would you please unmute your phone?
Good afternoon, everyone. This is Dr. Farzad Kamyar here, a psychiatrist in the state of Nevada. Just calling in support of this initiative to get the collaborative care or the PQC going. Dr. Erie and everyone has done a fantastic job of providing sort of evidence and presentations. Something that's specific to mental health, which is sort of my forte. Of course, all the different patient safety bundles are important, but just as a reiteration, 2 of them are specific to mental health. That includes perinatal mental health disorders and then also substance use disorders. So as an example of how this would play out would be, collaborating and providing these standards and protocols that would call for something like, all practitioners in the state, regardless of the location of the birth, screen for perinatal mental health and substance use disorders. So I don't find that it, so much dictates what has to be done, just provides best practices, because I think at the end of the day, everyone, right, wants to do right by their patients and wants optimal outcomes for both, mom and baby. And so something like this is just something that I think every Nevadan deserves, right, is to have better care, better evidence-informed care, and better outcomes. Thank you.
Thank you so much. Before you leave, Doctor, would you mind spelling your name for the record, please?
Yeah, for the record, last name Kamyar, first name Farzad, Farzad.
Thank you so much. BPS, are there other callers in support of Assembly Bill 179?
Callers, if you would like to testify in support of Assembly Bill 179, please press raise hand or star 9 in your Zoom window. Chair, there are no other callers choosing to participate in support at this time.
Thank you so much. We'll go ahead and move into neutral testimony in our physical locations. Is there anyone in Carson City who'd like to provide neutral testimony? Thank you so much. If there's anyone in Las Vegas who would like to, please come up to the table and we'll call on you next. Please remember to state your name for the record.
Thank you, Madam Chair. My name is Helen Foley, and I'm here on behalf of the Nevada Association of Health Plans. It's a statewide trade organization representing 10 member companies providing commercial health insurance and government programs in Nevada. We thank you for the opportunity to testify in neutral. Our members are supportive of the creation of the Perinatal Quality Collaboration, or Collaborative, and look forward to working alongside other stakeholders on improving care for both mothers and babies. However, we do have some questions we'd like to continue to work with the sponsor to clarify, specifically on Section 4, Sub 4D. The section notes that the collaborative is entitled to information from medical facilities and providers of health insurance concerning the cost of perinatal care and other information that the collaborative requires. While we appreciate what the collaborative seeks to accomplish, the language does remain broad, and we hope to work with the sponsor to narrow the definition on what falls within the umbrella of concerning the cost of perinatal care. We have connected with Assemblywoman Gorlow, and we appreciate her willingness to work with us on this important bill. Thank you.
Thank you for your testimony. Is there anyone else in Carson City or Las Vegas for neutral testimony on Assembly Bill 179? Seeing none, BPS, is there anyone on the call for neutral testimony on Assembly Bill 179?
Callers, if you would like to testify in neutral for Assembly Bill 179, please press star 9 or raise hand in your Zoom window to take your place in the queue. Again, if you would like to testify in neutral for Assembly Bill 179, please press star 9 or raise hand now. Chair, there are no callers choosing to testify in neutral at this time.
Because we had some complications earlier, can we just poll them to see if anybody has any testimony on Assembly Bill 179 before we close out testimony?
One moment, Chair. Are there any other callers that would like to provide testimony on Assembly Bill 179? Please press star 9 or raise hand in your Zoom window. Chair, it appears there are no other callers choosing to testify at this time.
Thank you so much for checking. I would invite the sponsor if she has any closing remarks. Okay, we're waiving closing remarks and moving on to Assembly Bill 259. So we'll close out Assembly Bill 179 and open Assembly Bill 259, which revises provisions governing wages for persons with disabilities. Please remember to state your name for the record. You may begin.
Thank you, Madam Chair, Vice Chair. We know where you are, members of the committee. For the record, Tracy Brown May, Assemblywoman representing Assembly District 42. I know you all thought I was just hanging out here all day because I really just wanted to join HHS.
That was my fault. I apologize. I didn't have a list of names on my sheet and I just took them in orders. Thank you for sticking around.
It's so good. I'm so honored, really, and excited to be here today. This is an issue that has come before this body on multiple occasions, and I have always been the opposition, so it's kind of interesting that I am here presenting the bill. So we're working off of a conceptual amendment today that you all should have. It is definitely up on Nellis. It was delivered to each of your offices. It has been reworked. I do have in the audience today Jessica Adams, who is the Deputy Administrator Director. I never get that title right. Thank you, Administrator, with the Division of Aging and Disability Services here in Nevada. We work very closely on this bill. As I begin, it's also important for you to note that this bill in particular pertains to the industry that I work in. It affects all of the provider organizations. And so I've spent a number of years working in disability services, and this bill is specific to that industry. So there will be a lot of background information. If you're interested in it, we'll do our best to keep it just quickly moving. We're here really today to consider the evolution of disability services in Nevada. We're going to talk about sub-minimum wages, and very often when I bring that topic up, sub-minimum wages for people with disabilities in Nevada, I get that, well, it doesn't really belong in the Health and Human Services Committee, right? Because it's about wages and labor law. But the peculiarity about this issue is that it affects people with disabilities. So in Nevada, it falls under Nevada Revised Statute 435, which governs how we support service for people with developmental disabilities, okay, which is why it's here. So I'm going to give you a little bit of history to sort of wrap around how this was all created. The Fair Labor Standards Act was considered landmark legislation back in 1938. And what it did was it enabled provisions regarding overtime, wages, youth employment, right? So it talked about a lot about employment issues, which was excellent and wonderful landmark legislation. Section 14C is the specific piece that addresses employment of people with disabilities. And it was designed at that time to provide employment for veterans who were returning from war. In 1938, we didn't really have any understanding of the capabilities of a person with a disability in competitive employment. So this mechanism was meant to encourage the employment of veterans with missing limbs, honestly. And so that was the original section of law. Over the years, the usage of the Fair Labor Standards Act in this particular section, Section 14C, has evolved. and was utilized during deinstitutionalization in the 1970s as a way for community provider organizations to engage people with developmental disabilities in a productive activity where they could receive compensation for a wage at the rate at which they were producing. It was a great tool. It's still utilized by some providers here in Nevada, and our numbers continue to diminish. Over the years, there have been many, many efforts to lift people with developmental disabilities in competitive integrated employment as utilized by the federally, by our advocates federally who are working toward equity and inclusion for people with disabilities in our community. The Workforce Innovation and Opportunity Act was signed into law by President Obama, and that shifted how we look at employment activities and integration for people with intellectual and developmental disabilities. And it stopped the pipeline of kids with disabilities aging out of high school and into sheltered workshops. Those shelter workshops have now evolved, and they're different day activities programs that provide a different level of support service. So over the years, the provider network has worked diligently to decrease its reliance on sub-minimum wages. This bill continues the transition in Nevada and helps to support the provider network that's working to support people with disabilities. So it shores up both the nonprofit agencies that are working to support people with disabilities and the people with disabilities who are working toward employment activities. 3 things are important to note. This bill eliminates sub-minimum wage certificates from Nevada effective January 1, 2028, which is 2 renewal cycles. There's a transition period. It's not meant to stop quickly. That's 2 renewal cycles for existing organizations that have certificates. It provides for time and a transition plan for jobs and day training providers that are serving people with disabilities. And it requires the Division of Aging and Disability Services to amend the state home and community-based services waiver to include benefits planning, which is a barrier that many folks with developmental disabilities face when looking for employment opportunities. They just don't understand how to maintain Medicaid benefits or other federal or state benefits as they pursue employment opportunities. Who's affected by this bill? Currently, there are 5 organizations in Nevada with active 14C Department of Labor certificates. Together, they serve a total of 148 people with disabilities, and 2 of those organizations are in the process of transition currently. Together, they serve 125 of those people. They're in the process of transition right now, which will be done over a 2-year period of time. That leaves 3 organizations that serve a total of 24 people. When we started to work toward this, so the last time this bill was presented, we were serving over 1,000 people with developmental disabilities in 10 organizations. I just want to show you the amount of work that's been done to help the provider organizations successfully transition. And then related to this, although not in this bill, the state has worked diligently to fund the direct support services under the Medicaid waiver. So there's a projected rate increase for those provider organizations to continue to enhance the level of supports that they provide. The waiver rewrites that are requested in this bill will help to increase the support services to engage people in community employment where appropriate and access day activities that are unpaid. So what this bill really does is it separates employment opportunities at or above a minimum wage from day activities and other pre-vocational or day habilitation programming that our providers are providing. With your permission, I'll walk through the bill.
Walk through the amendment?
Yes,
okay, good.
Yes,
Go ahead.
Thank you. Section 1 identifies that the section of law we're looking at is NRS 435, which is disability services. Section 2 defines the meaning of competitive integrated employment, which is equal to the federal identification of that language. Section 3 requires jobs and day training providers that have existing sub-minimum wage certificates to create a transition plan for the people that they're currently serving. And it sets the transition deadline of January 1, 2028. It requires the plan to be submitted to the Division of Aging and Disability Services for their review. If ADSD does not feel like it is an appropriate plan, then they can ask for a resubmission from the JDT provider. Section 4 indicates that a person receiving services on a sub-minimum wage certificate may choose an advocate, and if they do not have an advocate that can help them through their process, one may be requested through the division. Section 8 identifies a deadline for new entry into subminimum wages as January 1, 2025. So any new student transitioning out of high school into a center-based training program can no longer enter into a subminimum wage program as of January 1, 2025. That gives a full year to develop a new transition program. Section 11 requires the division to apply to the Secretary of Health and Human Services to amend the state waiver to include benefits, counseling, job coaching, and job development where it doesn't cross over with the Division of Vocational Rehabilitation, right? So we have some folks that would be served through DEED or Voc Rehab. These are folks that would be served under the Home and Community-Based Services waiver that don't qualify for Voc Rehab services. Section 12 eliminates subminimum wage certificates issued under Section 14C of the Fair Labor Standards Act from Nevada in its entirety. That is the amendment.
Thank you. I had a bowl of soup for lunch today, so I was a little sugar dive. Are there questions on the bill? Yes, Assemblyman Gray, please go ahead.
Thank you, Madam Chair. Just a quick question. With the elimination of the sub-minimum wage waiver and raising their wages subsequently, would this make them ineligible for other benefits through Social Security or any other things that they may be getting? I mean, could this actually do more harm than good?
Assemblywoman Brown, for the record, thank you for that question. Many times what will happen, so the answer is no, because the person is not going to work part-time or full-time. We're not talking about 20 hours at minimum wage. We're talking about incremental employment, but when they're productive, should be paid at a rate that's minimum wage. And so that's why the benefits planning piece is written into the waiver, so that the person with a disability who's considering moving into that then does not jeopardize any of those other federal or state benefits. We would never want a person who has a very expensive medication that's covered by Medicaid to go to work for $15 an hour to not be able to afford their medications. So this benefits planning piece is an important component. Currently in Nevada, the Nevada Disability Advocacy and Law Center does benefits planning. They cannot do benefits planning until a person has a bona fide job offer. So this helps us plan on the front end by including that in their waiver plan so that there is no harm done. Thank you for that question.
Thank you, and thank you for the response. Are there other questions from the committee? Seeing none, we'll go ahead and move into testimony. We'll start with support testimony in our physical locations. We are losing Las Vegas to another committee that starts at 4 o'clock. So I will check in with Las Vegas. It doesn't look like there's anybody in the room. Seeing none, we'll go ahead and start here in Carson City. Please remember to state your name for the record. You may begin when you're ready.
Hello, everyone. Again, my name is Catherine Nielsen, the Executive Director of the Nevada Governor's Council on Developmental Disabilities. We will be submitting our testimony in writing, so to save you guys some time, but I am here to help Alyssa provide her testimony. Would you like to introduce yourself?
Alyssa Marquez. Your turn.
Go ahead, turn your mic on. She stated that her name is Alyssa Marquez and she is our intern. Her testimony states that I support AB 259 because when I worked at a daycare in 2019, I did not get paid to help the younger children. I was told I was a volunteer. There was another worker who got paid regular wages that had me doing her job. My mom told the director of the daycare and that person was let go. When the pandemic closed the daycare, I stayed home. When the daycare opened again, my mom asked if I wanted to go work again at the daycare. I said no, because they don't pay me. I want to make money so that I can buy stuff and get my own apartment. I have my own checking account and savings accounts, and I have an ABLE account. I like to work, and I like going every day. I want to get paid so my mom doesn't have to pay for everything. It makes me feel good when I can buy my own stuff. Thank you.
Thank you, and thank you, Ms. Marquez. I just want to say I like your elephant. They're my favorite animals, too. I have one on my support water bottle. Thank you.
Thank you.
Please go ahead and remember to state your name.
Thank you, Madam Chair, members of the committee. For the record, my name is Ashley Cooper. I am the Manager of Advocacy and Government Affairs for Opportunity Village. We're really excited to support this bill. Thank you.
Thank you. Please go ahead. Remember to state your name for the record. Will you turn your mic on? There's a little mic button right there.
Oh, got it.
Thank you.
My name is Mark Christensen. I serve on the executive board of SNAP, the State of Nevada Association of Providers.
We represent 22 disability providers that contract with the state of Nevada to provide disability services. I want to let you know that our organization is in full support of AB 259, and thank you for allowing me to testify today.
Thank you for your testimony. Are there other folks in Carson City who would like to provide support testimony on Assembly Bill 159? Seeing none and seeing no one in Las Vegas, BPS, is there anyone on the phone line who would like to provide support testimony on Assembly Bill 259?
Callers, if you would like to testify in support of Assembly Bill 259, please press star 9 or raise hand in your Zoom window to take your place in the queue. Again, if you'd like to testify in support of Assembly Bill 259, please press star 9 or raise hand in your Zoom window now.
Good afternoon, Madam Chair and members of the committee. Stephen Cohen for the record. Stephen with a V. Cohen as in the Assemblywoman, known on relation. Ditto. Thank you, and I yield.
Thank you, Mr. Cohen. Are there other folks on the call-in line?
One moment, Chair. Caller with the last 3 digits, 511, you are unmuted and may begin.
For the record, hello, committee. For the record, my name is Paula Luna, Operations Manager at Battleborn Progress. We support AB 259 because every single Nevadan deserves to have equitable wage. We thank Assemblywoman Brown May for championing this measure. Individuals with disabilities should not be paid less than minimum wage, and AB 259 rights this wrong. Pay equity includes persons with disability. With this body moving the needle forward on raising the minimum wage in a previous session, AB 259 is another step in the right direction. We cannot imagine paying an employee less than a state minimum wage. It is near impossible for individuals to provide for themselves, let alone a family, if they are making minimum wage. Persons with disabilities should not be marginalized further by receiving inadequate pay. We urge this committee to support AB 259 so we can work towards pay equity for persons with disabilities. Thank you.
Thank you so much. Next caller, please.
Caller with the last 3 digits, 653, will you please press star 6 to unmute your phone? You may begin.
Good morning, or good afternoon, Chair Peters. This is Dora Martinez with the Nevada Disability Peer Action Coalition. We wholeheartedly, stop it. We wholeheartedly support this bill, and thank you to the sponsors. Have a good day. Go.
Thank you, Ms. Martinez. Next caller, please.
Callers, if you have recently joined and would like to testify in support of Assembly Bill 259, please press star 9 or raise hand in your Zoom window now to take your place in the queue. Chair, there are no other callers choosing to testify in support at this time.
Thank you so much. We'll go ahead and move into opposition testimony in our physical locations. Is there anyone in Carson City who'd like to provide opposition testimony on Assembly Bill 259? Seeing none and nobody in Clark County, in Las Vegas, BPS, is there anyone on the public line who would like to provide opposition testimony on Assembly Bill 259?
Callers, if you would like to testify in opposition to Assembly Bill 259, please press star 9 or raise hand in your Zoom window to take your place in the queue. Again, if you would like to testify in opposition to Assembly Bill 259, please press star 9 or raise hand now. Chair, there are no callers choosing to testify at this time.
Thank you. We'll go ahead and move into neutral testimony in our physical locations. Is there anyone in neutral testimony who'd like to come up to the desks in our Carson or Vegas locations? Please remember to state your name for the record. You may begin.
Thank you, Madam Chair, members of the committee. My name's David Ravetti, and I'm chairman of the board for Alpha Industries, which is I wouldn't call it a sheltered workshop. We like to refer to it as a supported work environment for people with disabilities. And currently we have 49 people with disabilities at our facility. Basically, we manufacture wire connectors. We put wire on connectors, and we have contracts with companies such as IGT and other electronic companies. Paying minimum wage, we could handle. We have, it's a very interesting business model in that we don't have any shareholders. We don't give out bonuses to the executive team. Our executive director makes, frankly, I don't really know why he's working for us. He makes so little money. Yet, we can't raise our prices on the products that we sell because we have competition, mostly China, and other factors, and our rates, our expenses go up. So adding a minimum wage is something that needs to be done. It's something that's correct and something that we are going to do. However, I want to point out that there's one expense that we have that I understand hopefully will be corrected, and I just want to make sure that that's on everybody's mind, and that's our cost for direct support staff. Currently, we augment the wages of the direct support staff, mainly because it hasn't increased in 19 years. So it's pretty hard to find support staff for around $10 an hour. Basically, we have that's a major expense of ours, and it is in our contract with Medicare that we have a certain amount of support providers. It's my understanding that the Aging and Disability Services Division will increase that substantially, and with that in mind, we would be able to continue our business, hopefully. We've been around since 1976, and so that's 43 years. Hopefully we can do another 43 years, but we will need that increase in payments to the direct support staff. Thank you.
Thank you for your testimony. Is there anyone else in Carson City who'd like to provide neutral testimony? Seeing none. BPS, would you check the public line for neutral testimony on Assembly Bill 259?
Callers, if you would like to testify in neutral for Assembly Bill 259, please press star 9 or raise hand in your Zoom window to take your place in the queue. Again, if you would like to testify in neutral for Assembly Bill 259, please press star 9 now or raise hand to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. With that, I'd like to invite the bill sponsor up for closing remarks if you'd like.
Thank you, Chair, and members of the committee. I really, as we close this bill hearing, I want to first thank you for the opportunity to hear this bill and to point out that this really is pivotal to the future of the provider organizations that are serving our community. I would be remiss if I did not acknowledge the years of dedicated effort it has taken for those organizations to transition their business models away from a sub-minimum wage opportunity for people with disabilities and into an enhanced day training opportunity. You've heard the testimony. It's a very difficult thing to do, and these organizations that do it are doing it because they love to serve people with disabilities who are marginalized in our communities. So thank you very much for hearing this bill today.
Thank you, Assemblywoman. We'll go ahead and close the hearing on Assembly Bill 259. And I see our Assemblywoman Summers Armstrong is in the room. We'll go ahead and open the hearing on Assembly Bill 283. Yeah, a lot of folks here. Welcome, Assemblywoman. Thank you for being here. Please remember to state your name for the record. You may begin when you're ready.
Thank you, Madam Chair and members of the Health and Human Services Committee. My name is Chandra Summers Armstrong, and I'm the Assembly Representative for Nevada Assembly District 6. Today, we have quite the presentation for you on Assembly Bill 283, which seeks to increase funding and payment for birth doula services. We do have a presentation. I see one of our presenters is on. So with me today is Emily Bailey. Barney. Yeah, I know I'm so bad with names. And Joyce Abang. And on the line, we have Jolena Simpson, and we have a person who's going to testify on video, and we also have some folks in the audience. Just like to give you a little bit of background. In 2021, we brought a bill, AB 256, that allowed for the first time in the history of Nevada for birth doula services to be covered by Medicaid. That bill passed through both houses and was signed into law. We went through a process of registering doulas, clarifying their roles, education requirements, and getting them onboarded. That took until April or May of last year. Here's the issue that has arisen is that the pay for these doulas is 4 to 6 meetings with their client and the birth for a grand total of $450. And we wonder, with the amazing work that doulas do, why we were unable to get doulas to sign up. We know that doulas help us have vaginal births with least amount of issues when we have intervention with doulas and assistance with doulas, but we cannot expect folks to do this type of work at that dollar amount. So my co-presenters are the experts. I am going to be quiet, and I'm going to let them tell their story because I think it's important that you know where they're coming from and what they do and the beautiful service that they offer for the children of Nevada to be birthed with love and care. So at this time, I'm going to pass the microphone over to Emily, and she's going to begin.
Oh, we have a presentation. We're going to check and make sure that that is visible online as well for folks. Yeah, BPS, it's good to go. Looks like we've got it up. Thank you. Please remember to state your name for the record.
Hello, good afternoon, Madam Chair and members of the committee. My name is Emily Barney. I am a birth doula, a postpartum doula, and a death doula. I am practicing privately here in Washoe County and across the state of Nevada. If someone wants to fly me out there, I'll go. I'm also a newborn care and parent educator, and I am the executive director for the Doula Co-op of Reno, a Nevada-based nonprofit that seeks to expand access to doula services to all Nevada families, focusing our work with the underserved and marginalized communities of Nevada. Next slide. So in my work as a doula, I provide non-medical, emotional, physical, educational, and community resource support for families and birthing people throughout their prenatal, labor, and postpartum periods. If that sounds like a mouthful, it's because it is. And what it means is that birth doulas, like myself, are trained to understand and recognize the physiological processes of labor. We're able to translate this knowledge to parents and empower them to experience their birth in a way that addresses their fears and centers their needs. Next slide.
You will soon learn the statistics of why doulas are effective at what we do. But I'm gonna here tell you why. We provide continuity of care. We coordinate across provider disciplines to help parents understand the resources that they have available to them. We establish a relationship and trust prenatally that lasts through until 3 or 4 weeks postpartum. We are with them through it all. That includes facilitating comfort and safety and confidence in labor, and then normalizing, validating, and listening to their experiences postpartum so they feel less alone. The work that I do for my clients is deeply rewarding. I am called to serve the families I do, and I have a talent for this work. It is also physically demanding, emotionally impactful, and very time-consuming. Next slide. There was a time use study out of San Francisco that stated the estimated time that a doula spends with their client is 50 hours a month doing client care and support. Now, those are not just numbers. That is my life. Those are the hours of my life and the time that I spend every day with the clients, working directly and indirectly to coordinate their care. When I spend 12, 24, or 40 hours in a row supporting clients through their labor and birth, that means I have to be able to drop the responsibilities of my personal life and support my clients through what is arguably the more transformational moment of theirs. Due to demand on my time and energy, I can only take 1 or 2 birth clients a month, and my fee for services is $1,500. Next slide. Under the current Medicaid legislation, the work that I do is unsustainable to join the population of Medicaid birthing families. In the past year alone, I've needed to work 4 jobs in order to make ends meet. Considering that I'm an independent contractor of the state and incur expenses and taxes as a small business owner, working with the Medicaid population is near impossible for me to do at the current reimbursement rate. I would need to be taking 3 or 4 Medicaid clients for every 1 client that I'm taking privately. What was previously unsustainable is now insurmountable. Without being paid a living wage, doulas are simply not incentivized to work with the Medicaid clients, which leaves these families without support and program dollars underutilized. Doula work is my world, my livelihood, and my purpose, and passing this bill means myself and other doulas continue to do this valuable work. Thank you for your consideration on passing this bill. I now will pass it over to Joyce Abang to share with you some deeper dives.
Thank you so much. Please state your name for the record.
My name is Joyce Abang. I work at the Larson Institute at the University of Nevada, Reno, and I work in public health research. In today's presentation, I am serving as a subject matter expert, and I will not be advocating for or against the bill, but rather providing information. According to the 2020 and 2021 Maternal Mortality and Severe Maternal Morbidity Report, Nevada's maternal mortality rate from 2018 to 2020 was 19.2 per 100,000 live births, higher than the Healthy People 2030 objective of 15.7 per 100,000 live births. Healthy People 2030 are data-driven national objectives set by the U.S. Department of Health and Human Services to improve health and well-being over the next decade. As this statistic shows, we're falling behind. From 2017 to 2018, in Nevada, Black non-Hispanic Nevadans had a mortality rate that was 4.3 times higher than rates for non-Hispanic Nevadans, and 5.2 times higher than Hispanic Nevadans. There is a considerable amount of well-researched studies showing that doula care is a high-value model that improves childbirth outcomes, increases the care quality, and can achieve cost savings for managed care organizations and the state Medicaid program. Cost analysis have found that doula care can reduce overall spending by avoiding unnecessary medical procedures and the potential complications and chronic conditions that may result in reducing NICU admissions and fostering health practices such as breastfeeding. In the 2017 Cochrane Review, there were 27 randomized control trials that studied the effects of continuous labor support, including doulas. Overall, those who received labor support had decreased in unwanted medical intervention, which includes a 39% decrease in the chance of unplanned C-sections and overall less anxiety and less pain. Many studies have shown that doula support provided during pregnancy, birth, and the postpartum period lowers the rates of cesarean deliveries, which, according to estimates in Nevada, cesarean births cost $3,000 to $5,000 more than vaginal deliveries. Doula support also reduces rates of prematurity and illness in newborns and the likelihood of postpartum depression. Post-cesarean pain is a common problem with significant health and economic impact on the individual patient as well as the society. Cesarean deliveries, while we call it a birth, it is major abdominal surgery, and the healing process post-cesarean is lengthy and costly. Across the nation, Medicaid reimburses doulas for their time providing continuous labor support during birth and at prenatal and postnatal visits. Many states are pursuing ways in which doula services can be reimbursed at a living wage. A sample of the states are Washington, D.C., Rhode Island, Michigan, California, New Jersey, and Oregon. Washington, D.C. is reimbursing $683.22 per birth and $97 per visit. Rhode Island is reimbursing $900 per birth and $100 per visit. Michigan is reimbursing $700 per birth and $75 per visit. California reimbursement fee is $1,154. New Jersey's reimbursement fee has an average of $1,198, and Oregon's Medicaid program has been working on increasing the reimbursement rate to $1,500. Rather than continuing with statistics, I am excited to introduce Mei Chin, who is not a statistic, but a mom, a new mom, whom with help of her doula provided by the Medicaid program was able to receive the support of the birth of her first child just last week.
Hi, my name is May. I'm a foreigner single mom without family support in the U.S. She is my first baby, which means I didn't have any labor experience before her. I got emergency Medicaid assistance based on my status. By chance, when I was 37 weeks pregnant, I met with the two doulas, Sue and Angela. They were willing to assist me with my labor. During the 37 hours labor, my OBGYN would like to do cesarean section to have my baby. However, we have tried 36 hours to avoid it. My two doulas suggested alternate options, and my doctor chose to do a vacuum extraction, which worked, and my baby came to the world. Thanks for my doula being there with me, mentally and physically supporting me during the 37 hours of labor, and avoid the cesarean section from happening. Thank you.
Thank you, Ms. Chin. Please go ahead.
At this time, we're going to move it over to Jolena Simpson. Jolena, please turn on your microphone.
Jolena Simpson, for the record. Thank you, Madam Chair, and thank you, May, for sharing your birth story. Madam Chair and members of the committee, this is the impact of doula work. May is a mother of a 10-day-old newborn, and she was willing to join us today to share her story and advocate for more doulas supporting Medicaid clients. That is powerful. In the 81st legislative session, this body approved AB 256, doula services reimbursement through Medicaid, because they saw the value of doulas for birthing families in Nevada. In the fiscal note for AB 256, future savings for the state was approximated at $1.2 million. That savings was only based on the difference between vaginal births and cesarean births. But that savings will only be realized if doulas who enroll can earn a living wage while working with the Medicaid population. I would like to offer a little more information on the savings that were not brought up during the 81st session. As Joyce stated, C-sections are associated with a risk and complications in future births. In addition, many birth parents experience physical ailments in the months following their birth, such as infection and other cardiovascular conditions that can lead to death. Also, women on Medicaid who have a doula have a 22% lower odd of delivering preterm, which can lower NICU admissions. Finally, in 2013, the CDC did a study that reported doula-supported births at a near universal breastfeeding initiation rate at 97.9%, compared to 80.8% in the general Medicaid population. Among African American women, that percentage was 92.7% of initiation of breastfeeding, compared to the Medicaid population average of 70.3%. We looked across the nation at states actively reimbursing doulas. The average reimbursement for all of those states is $1,224 for 8 visits, which includes prenatal, postpartum, and the birth. The current Nevada reimbursement is $450 for 7 visits, which is well below the national average. The rate increase proposed takes into account Nevada's 6.2 increase in cost of living, the accurate calculations of the time spent with our clients delivering services. It also includes the fact that doulas are small business owners, subject to all the taxes and expenditures of a business, including our enrollment fees, continuing education, childcare for our children, and healthcare for our families. Now, let's do a little Nevada math. All right. I don't have my slides up, so I want y'all to get out your pens and papers, see if we can follow along. All right. So we currently have 7 enrolled doulas and 11 more in the pipeline. So by the time we finish this session, we are looking at 18 doulas. Those 18 doulas can take an average of 2 clients per month for the year, equaling 432 births. Okay. Now, if we follow the Nevada cesarean section rate, which is approximately 33%, that would equal 142 births out of the 432 of those doula attended births. But we know from Joyce's testimony that the Cochrane review noted that there's a 39% reduction in cesarean births when attended by a doula. So if we adjust that 142 births accordingly, it will go down to 87 births. The cost difference between 87 and 142 cesarean births is approximately $1,748 per person each year. With the doula rate increase up to $1,500, there will be a savings of $248. Now, that is a pretty big drop, but in the fiscal note from the legislative session 81, that savings was approximately $900. So when we look at the savings, there is a smaller savings, but there is still a savings to the state. In the fiscal note for legislative session AB 256, it was only looking at vaginal and cesarean births. Now, we know, Madam Chair, that there are greater savings with doula-supported births than just the numbers between vaginal and cesarean. And I want to say to you, Madam Chair, and members of the committees, that doulas provide support and advocacy in ways that our medical system often cannot. We feed the humanness of our birthing persons and families. We care for them in community because we care deeply about our community. Research has shown that doula care can help mitigate some of the negative social determinants of health, such as poverty and systematic racism, which can impact birth outcomes in all populations, but especially in Medicaid populations. Doula care provides clients with lower medical interventions. It provides them with agency, feeling of personal security, respect, and autonomy. Doulas provide knowledge transference and connectedness to the community. In communities of color, rural environments, and low-income communities, this translates to long-term savings for the state of Nevada. We cannot and should not sacrifice the livelihood of doulas to achieve that end. Thank you for your time.
Thank you, Ms. Simpson.
Thank you, Madam Chair. I think that my co-presenters have done a much better job than I ever could have done. We do have a conceptual amendment and that is we had some discussions with the folks at HHS, and recently the federal government has brought in the proper funding codes for doulas, and so that is delineated in the proposed amendment. And they've also sort of readjusted the reimbursement amounts to sort of be more in keeping with what we're seeing on the national average. With all the visits together with your pre and post-birth visit and with the birth, it still comes out to be, I believe you said, Jolena, $1,500 all told. And we just believe that that is fair and equitable work for what is being done. And at this time, we would be happy to answer any of your questions. Thank you.
Thank you. So I'm not seeing the conceptual amendment. Did you email that into staff today?
I thought we sent it last evening, but I will have my crack assistant bring down some copies right now. Thank you. I'm sure she's watching.
Thank you so much. We had quite a few exhibits come in last night, so it might have gotten missed in the shuffle of things. But you did say that the amendment addresses the $1,200 in here and modifies that to $1,500, or did I misunderstand that?
Yes, please.
It does modify it, Madam Chair. So the conceptual amendment modifies the CPT codes to be HCPCS codes, which are doula-specific codes that have now entered the federal government as approved Medicaid codes. So those are non-medical codes, as we are a non-medical profession. And that would lower the rate for the code for labor and birth, which differentiates between the codes for prenatal and postnatal visits. So what we are doing in the amendment is asking for $900 for presence at the labor and birth per diem, rather than the CPT codes that have been provided in the original bill. And then for the visits for pre and postnatal, those would be raised to $100 a visit, maximum 60 minutes per visit. And those would be 6 visits in the total pregnancy. So the package comes to a total of $1,500, $900 for the birth, $100 for each visit, up to 6 visits.
Thank you for that clarification. And that's similar to the Rhode Island model, I believe, from your presentation?
It's exactly the same, yes.
Just as a point of clarification, currently the doulas are paid $50 for their prenatal and postpartum office visit and $150 for a birth. So just to put that into, make it clear.
Thank you. I have a question, I believe, from Assemblyman Nguyen.
Thank you, Chair, and thank you to my colleague, Assemblywoman Summer Armstrong, for bringing this forward. I did sign on to it as a co-sponsor, and I know that we're not a money committee, so I'm not going to ask the money question, but I'm just going to ask the question to the experts on the panel here is that since the bill has passed from last session on the doula eligibility until now, what has been done in terms of outreach? Are the Medicaid populations aware of these doula services? Just full disclosure, I had to look up the definition in my native language and didn't even know that that's something that is available in this types of environment. So even as a parent myself going through the process, didn't even aware of it, on that side. So I do support the fact that we need to compensate all of our profession the right way, and that's not the question here. The question is, how has the outreach been done, and what have been the results?
If I may, Jolena Simpson, make it with Nevada for the record. Each health management organization has been handling their own outreach, and many of them are currently running pilot studies where they help to enroll Medicaid recipients into those pilot studies. And that is a lot of the outreach that is being done. But on the ground with community organizations, such as the Doula Co-op of Reno And in Las Vegas, we are actively recruiting doulas to fulfill the need of the Medicaid population.
Thank you again. And just to follow up on that, in terms of what Ms. Barney said earlier about the underserved communities, and those come with the language barrier, how has those outreach been to these types of language need communities?
Thank you for that question.
Please
So-
remember to state your name before you speak every time. It helps us with just our transcribing of the minutes.
Yep, heard. This is Emily Barney for the record. Thank you for the question. And what we are doing for that, the Doula Co-op of Reno was created in lieu of the 81st section passing of this bill. And we have, as Jolena said, been actively recruiting doulas to work. It's very hard to incentivize doulas to work out of private practice to get there. What we did was to start a program with Renown Hospital up in Northern Nevada. So we've begun this hospital program. It's called the Doula Access Program. And what we have realized is that there are doulas hungry to work in this population. And what we also realized is that there is a large Hispanic, Spanish-speaking population that is serviced by Renown. And so the Doula Co-op, as an independent nonprofit organization, we hired a Spanish teacher to teach our doulas Spanish in specific medical terminology that works with doulas and doula language and the clients to create some continuity between the care that they are receiving and what we can provide. So we are working on it, and we know that that's a barrier. And with more support and more money going towards us working with this population, we can serve a greater population and a diverse language base as well.
Thank you for the question.
Madam Chair, if I
yes.
may.
Yes, please go ahead.
I think what you're getting at is, Assemblywoman Chandra Summers Armstrong, for the record, if I could just clarify, are you asking for the doulas themselves or the recipients, those who are in need of the service?
Two parts to my question. The first one was the recipient, and then the second part follow-up was the actual organization itself in terms of reaching out and ensure that the underserved communities are being served.
Thank you, Madam Chair. If I may reply, I think that what we see in many of our underserved communities that have either cultural or language barriers, we don't have representation. And so if we can encourage folks to do this work and be paid a living wage, I think we will see more participation across the board. When we don't value the work that women do, we don't get them to do this type of work and to be able to sustain their families. My hope is that as we are working diligently to increase the pay, to make it reasonable for folks to do this, it will spread. We will then be able to see women of every ethnicity joining in to learn and be trained and register to do this work. And then as the word spreads, it will get into those communities. Now, I don't know what process HHS is going through for their outreach. I think there's just a matter of coordination now that we finally have a process in place, that there may be some openings for us to do some things in the languages that are commonly spoken, but we just have to coordinate that and figure out where HHS is financially with their marketing program. Thank you.
Thank you for the comments and question. Are there other questions from the committee members? Yep. Oh, sorry, Assemblywoman Taylor.
Thank you, Chair, and thank you to our esteemed colleague and those who brought this forth. I had to look up doula. I first learned about doula a year or two ago. I had to look it up and then look it up again to remind me before we had some conversations on it. Just a question. I know that in our conversation we had, and then as you presented originally, is it currently that doulas get $450 per, and that's the whole situation? And then the bill, this is more clear than the bill, is saying at least $1,200, but we're really shooting for, and I know we don't have the amendment, but we're really shooting for $1,500. Can you kind of walk me through the $1,200, $1,500, or am I just not reading section 1? Am I not reading it correctly?
No, thank you for your question. This is Emily Barney for the record. The 1,200 was for the delivery codes specifically. The bill language is sparse, and so I understand the confusion. The 1,200 is just for the delivery codes, and then $50 for the visits. And then total,
Visits.
6 visits, 1,500 total. With the amendment, that would be shifted to 900 for the labor and 100 per visit, yes.
If I may make a suggestion, that maybe make that connection so that in here, that part, the $50 piece, I think the visits are important. But maybe as you work on and it's probably included in the amendment piece, so the 1,200 and 15 don't work against each other. So thank you very much. Thank you for bringing this bill.
Thank you for
Thank you,
that
Chair.
observation, and we will definitely take that as direction.
Okay, a suggestion. Thank you, Chair.
Thank you for the question. Other questions? We'll go ahead and move into support testimony. Thank you so much for the presentation. We will open support testimony on Assembly Bill 283 and the physical location up here in Carson City. Please remember to say your name for the record. You may begin when you're ready.
My name is Samantha DeAndrea, for the record. Good afternoon, Madam Chair and members of the committee. I am a mother, a doula, and a midwife, and a co-founder of the Doula Co-op here in Reno. I am in support of AB 283. I became pregnant with my daughter in 2011, and I was 19 years old, on state insurance, and suddenly needed to make massive decisions. I wanted to be informed and did much tireless research, but I found it difficult to be taken seriously in my concerns as a young mother and my desires around my pregnancy and birth. Despite conflicting information and anxiety, I decided that I wanted to birth without medication to encourage optimal bonding and success in breastfeeding. Instead, preventable complications led me to an emergency cesarean surgery. This was traumatic and disempowering for me personally, but it helped me to realize the need for birthing people to have access to personal support and more readily available information regarding their care. This lit a fire in me, and I became a birth worker in 2013. I have had the privilege of supporting many people through many aspects of their reproductive lives, and by its very nature, this work has shown me how vital a doula's role is in bridging the major healthcare gap that we have. The unique care doulas provide is difficult to quantify because it allows for the mental, emotional, and spiritual health of the individual, the newborn, and the family to be an active part of the care plan. Better outcomes are unattainable if we only value the allopathic aspect of care. When I look back on my own experience, I see a great deal of ways in which a doula would have been immensely supportive. I wish for all people to have access to a doula's wide-ranging and personalized care, because doulas will continue to be a key component in improving birth outcomes and experiences. Increasing the reimbursement rate for doulas working with Medicaid will help achieve this goal undoubtedly. Thank you.
Thank you for your testimony. Please remember to state your name. You may begin.
My name is Claire Murdoch, for the record. Good afternoon, Madam Chair and members of the committee. I'm a mom and a holistic birth and postpartum doula. I'm Nevada board certified doula, and I'm currently in the process of becoming a Medicaid provider. I also intend to become a certified birth educator and a certified lactation educator this year. I've also practiced as a certified nurse assistant at Renown in the postpartum department. I have so much love and passion for the work that I do, and I believe it is vital to the well-being of the Nevada birthing community. And I want to be financially able to serve the Medicaid families that deserve this care. Doula care is a specialty that deserves fair compensation. We aren't just holding clients' hands during labor then walking away. We are changing the landscape of birth and making the maternal health care system a safer and healthier place. We invest so much of our own time and money into what we do, and we want to be able to reach a wider demographic that includes the low-income families that especially need this help. So please, I urge you to vote in support of this bill so that doulas can serve those who need it most. Thank you.
Thank you for your testimony. Please go ahead.
Thank you, Madam Chair and committee members. My name is Natalie Powell, for the record. I am the director of the Nevada Certification Board. The board strongly supports AB 283. The Nevada Certification Board certifies community health workers, peer recovery and support specialists, and prevention specialists. In 2021, the Nevada Certification Board was approached by Nevada Medicaid to certify doulas or develop certification for doulas as a prerequisite for enrollment in Medicaid as a Medicaid provider. Birth doulas play a critical role in promoting health equity, reducing maternal and infant mortality and morbidity and mortality. And it's truly been a privilege to be affiliated with this group of primarily women right now. I did want to address the question about representation. The Nevada Certification Board recently required, although you do not have to answer every question, but we added a demographic section to all of our applications so that we can see what type of representation we have in our certified specialists, because we know there's a need. There's a need for representation and outreach for all of these services. So that is some data we're collecting, and we hope that will help us in outreach going forward. And I just wanted to end with the fact that the Nevada Certification Board believes strongly in providing a living wage for doulas and all of our certified specialists. Thank you very much, and thank you to the sponsor.
Thank you, and thank you for your work in the state. Please go ahead when you're ready.
Good afternoon, Madam Chair and Committee. My name is Dr. Angela Heineman. I am a professor in the School of Public Health at the University of Nevada, Reno. I am also a doula in the Doula Co-op of Reno because it is not only exciting but very interesting and important work that we're doing as doulas. I myself was at Mei Chin's birth and spent 30 plus hours in the hospital ensuring that, advocating for her and her birth, and it was really rewarding work. I can go on and on and on, but I think you've heard lots of important testimony about doulas and their importance, and I support AB 283. Thank you.
Thank you, and thank you for your work in our community. Are there other folks in Carson City who'd like to provide support testimony today? Seeing none, we'll move to the phones. BPS, is there anyone on the public line who'd like to provide support testimony for Assembly Bill 283?
If you would like to testify in support of Assembly Bill 283, please press star 9 or raise hand in your Zoom window to take your place in the queue. Again, if you would like to testify in support of Assembly Bill 283, please press star 9 now.
Hello, for the record, my name is Paula Luna, Operations Manager at Battleborn Progress. We're in strong support of AB 283, and we thank Assemblywoman Summers Armstrong for spearheading this critical measure. During pregnancy and childbirth, many individuals choose to have support from a doula or professional labor assistant. The physical and emotional support provided by doulas to the pregnant person and to their partner can help them feel support, safe, and cared for during a critical time in their lives. Doulas play an important role in assisting with the birth of the child and to support the parents. They should be paid adequately for doing such important work. AB 283 sets us on a path where doulas can be paid more fairly for the important work that they do, and we urge the committee to support AB 283 so doulas can continue providing care for pregnancy and childbirth while being paid fairly. Thank you.
Thank you for your testimony. Are there other callers on the public line?
Yes. Hello, Madam Chair and other members of the committee. My name is Sue Foltz. I am a doula. I have retired from a 30-year career in laboratory diagnostic medicine. I'm a mother of 3 and the co-founder and president of the Doula Co-op. My passion for birth work started while I was a GED tutor at Casa de Vida. Casa de Vida is a residential nonprofit serving pregnant, homeless teenagers in Reno. While I was tutoring these young women and building their trust, many of these future mamas asked me to coach them through their births. And wanting to support them, I studied and received 2 doula certifications. I knew after attending my first birth how vital it was to support the women in the Medicaid population, especially due to the lack of reimbursement for Medicaid doula services. I knew that I wanted to help start a nonprofit cooperative for doulas to support these at-risk, high-risk mothers-to-be. With the initial passing of the Nevada bill, AB 256, I knew that the 450 total Medicaid reimbursement for about 45 hours of work, equating to approximately $7.78 per hour of work, was not a sustainable income for doulas in Nevada to support themselves. With the new bill, AB 283, presented today, and the proposed living wage of $1,200 up to $1,500 for Medicaid reimbursement per birth, it is significantly more motivating for birth workers to go through all of the training, extra certifications, and paperwork to become a doula Medicaid provider in the state of Nevada. This new bill will not only support a living wage for doulas, but will save the state of Nevada in downstream healthcare costs for Medicaid insured births. Doula care has been researched thoroughly, and it is proven that doula care throughout a pregnancy, labor, and birth will decrease the amount of medical interventions during the birth, leading to healthier outcomes for mother and baby. I strongly support AB 283, and I am confident and hopeful that this legislative council will see not only the health and well-being benefits for Medicaid population and the cost savings to the state, but will also respect the work of a doula and reimburse their work at a living wage. As a side note, I supported a Medicaid mother as a doula earlier this month, and her labor and delivery lasted over 37 hours. At the current Medicaid reimbursement for labor and birth, I earned less than $4 per hour. Can a doula really afford to work for under $4 an hour? Thank you for listening, and I would appreciate your support for this bill.
Thank you, Ms. Folks. Are there other callers in support?
Hello, can you hear me?
We can. Please go ahead.
Hello. Thank you very much. My name is Dr. Mary Kilkenny. I'm a board-certified OBGYN. I work at Renown on Mill Street, running the Level 3 labor and delivery. I'm also an associate clinical professor of medicine at UNR School of Medicine. I support AB 283. I oftentimes find that we have psychosocial challenges in caring for our Medicaid patients. There are huge gaps in care and the support that more affluent patients take for granted. We desperately need to find a way to bridge those gaps, and supporting AB 283 is a way to help provide care that is just not forthcoming for patients who are often trying to bring a child into the world on their own with no support and no help. Thank you.
Thank you for your testimony and work in our state. Are there other callers in support?
Hello, my name is Jennifer Campbell, and I am testifying in support of AB 283. I was a doula and a lactation consultant for 12 years when I moved to Reno in 2005. I went through a divorce, and due to that, I had primary custody of 8 children at home, and as a sole breadwinner, I had to give up doing what I loved. I couldn't earn enough to support my family and instead worked up to 4 jobs in the, quote, corporate world as the schedule was consistent and I could earn more. In 2007, my certifications lapsed, and it was an emotional low in my adult life. Like many doulas, I felt like this life chose me through experiencing my own first pregnancy and birth, both positive and negative things, and I couldn't not help other women. For my 3 subsequent birth experiences, I had a doula, and she made a significant impact on how well things went, how supported I felt, a supported outcome where my well-being and experience was her primary concern. I also had a doula assist me through 3 of my miscarriages. My final pregnancy was a loss of twins at 16 weeks gestation. The emotional and informational support, her physical presence, and knowing I had someone in my corner assisted me in having such successful experiences that I wanted to pass on to other women. Over 18 months ago, and 15 years after my certifications lapsed and remarried, my husband asked me if I was ready to go back to doing what I love. We had to make some crucial changes to our finances so we could go to a one-income family and afford the coursework necessary and the time it would take for me to build a business. Many of us also add specialties in addition to birth doula. Mine are certified lactation educator, adoption and surrogacy doula, and bereavement doula. Now that I've been in this space again for over 18 months, I can attest the amount of hours we put in and that we have a schedule that is in part unpredictable. Doulas have the cost to become a doula, all administrative costs, gas and vehicle costs, daycare for our own children, and we don't have a staff to help us become providers or do our billing. And we are everything. But allow me to be clear, I love what I do. Unfortunately, I talk with pregnant women frequently that want a doula but can't access one due to lack of income and insurance that inadequately covers the amount of work doulas put in. I am 150% in support of AB 283. Thank you.
Thank you so much for your testimony. Are there other callers in support?
Callers, if you have recently joined and would like to testify in support of Assembly Bill 283, please press star 9 or raise hand in your Zoom window now to take your place in the queue. Chair, there are no other callers choosing to participate at this time.
Thank you so much. We'll go ahead and move into opposition testimony. Is there anyone in Carson City who'd like to provide opposition testimony today? Please remember to state your name and proceed when you're ready.
Good afternoon, Madam Chair and members of the committee. My name is Sarah Watkins. I represent the Nevada State Medical Association. Many of our physician members work with doulas in the delivery room, and they understand the important value of their care for the birthing person. Our concern with this bill is the rate proposed exceeds most of the physician Medicaid fee-for-service rates, which I can also submit those rates to the committee if you'd like to review them. For example, the rate for a physician to provide the service of a vaginal delivery with post-delivery care is $1,070. Also, the certification process for a doula is significantly less than an OBGYN or emergency room physician, and we believe education, time, and financial commitment should be considered when setting these rates. Thank you for the time.
Please go ahead. Assemblyman Hafen has a question for you. Ms. Watkins, if you can.
I apologize, Ms. Watkins. I actually was going to ask the exact question you brought up on how much the OBGYNs, as well as the nurses that are part of the delivery. Could you email that information to the committee secretary so we could have that information to review?
Yes, I'll be sure to email that.
I appreciate it. Thank you. And thank you, Madam Chair. I appreciate it.
We appreciate the follow-up. Thank you so much. Are there other folks who would like to testify in opposition today? Seeing none, BPS, could you check the public line for opposition testimony on Assembly Bill 283?
If you would like to testify in opposition to Assembly Bill 283, please press star 9 or raise hand in your Zoom window to take your place in the queue. Again, if you would like to testify in opposition to Assembly Bill 283, please press star 9 or raise hand now. Chair, there are no callers choosing to participate at this time.
Thank you so much. We'll go ahead and move into neutral testimony on Assembly Bill 283, starting here in Carson City. Is there anybody to provide neutral testimony? Seeing none, we'll move to BPS. Is there anyone on the public line to provide neutral testimony?
Callers, if you would like to testify in neutral for Assembly Bill 283, please press star 9 or raise hand in your Zoom window to take your place in the queue. Again, if you'd like to testify in neutral for Assembly Bill 283, please press star 9 or raise hand in your Zoom window now. Chair, there are no callers choosing to participate at this time.
Thank you so much. I would invite the bill sponsor up if she has closing remarks.
Thank you, Madam Chair. Chandra Summers Armstrong, Assembly District 6 for the record. Thank you, Madam Chair and committee members, for listening attentively to our presentation and giving consideration to this bill. I will reach out to the speaker from the American Medical Association to get some clarity and hope that I can just kind of understand their position. We had not had a conversation previously, and I apologize that did not happen. In closing, I'd just like to tell you all a little story. 1987, I was a young 25-year-old mom living very far away in a little town called Fisbeck, Germany, with my then military husband, and we were having our first child. My mother was not able to come from California to be in this small town to help me with the birth of my first child. And I was lucky enough to meet a woman, and her name was Frau Gisela Busa. She was exactly what her name implies. She was a stocky, brown-haired German woman who was a midwife. She didn't speak very much English, but I tell you what she did. She loved on me. She helped me birth my first two sons, Brandon and Dexter, at the Kloppenburg Hospital. She was my lactation specialist. She was my birthing specialist. She was everything. And I could not have done what I did without medication if it had not been for Frau Busa. The love that she gave me, and I mean it was love, is what the doulas that you've heard from today are offering women who are Medicaid recipients. I was a poor wife of a staff sergeant in the Air Force. We were barely making it. It cost me $120 for each of those births, and that included every visit to the doctor and all of the love and help that I got from Frau Busa. It makes a difference how babies are born. It makes a difference how moms are treated during the prenatal portion and the postpartum. It makes a difference how that child comes into this world. And I just ask that you all consider in Women's History Month that women's work, it has value, and that this bill be supported. Thank you so much for your help, for your consideration.
Thank you so much. We'll go ahead and close the bill hearing on Assembly Bill 283 and move to our last agenda item of public comment. Is there anybody in Carson City who would like to provide public comment today? Seeing none. BPS, could you check the public comment line for folks who would like to provide public comment today?
Callers, if you would like to provide public comment, please press star 9 or raise hand in your Zoom window to take your place in the queue. Again, if you would like to provide public comment, please press star 9 or raise hand in your Zoom window. Chair, there are no callers choosing to provide public comment at this time.
Thank you so much. Thank you all for your time today. Are there any closing comments from the committee before we adjourn? All right, our next meeting is Friday, the 24th at 1:30 p.m. With that, we are adjourned.